following the RSC 75 in Lusaka last year. If we want health security, we must buy African, regulate African, and trust African.
We cannot achieve or sustain local manufacturing by just building factories. We need an ecosystem, and everyone has said it, that will ensure that the manufacturers have the confidence to invest. If the regulator is not strong, then the investment can become a wasted investment.
This specific report provides you with information on health in the region. It not only focuses on where we stand as far as health is concerned, but also provides information on the progress made, some of the issues we are dealing with, and then the next steps regarding the future of health in this region.
One of the elements that is really important for mothers and women that this report put on record is the expansion of maternal and perinatal death surveillance and review. It brings in accountability that health workers can look at every death and review and really find out what is the cause of this death and was this death preventable and what can be done to ensure that another preventable death does not happen like this.
While the national averages are a good way to show progress, they also conceal differences between communities and between districts.
The report also highlights not so much the contraction and collapse of services, but the transformation that had to happen and is still happening in the way we deliver services, because that transformation then allows us to adapt to the contracted resources. And I think for me, that's the real story of the report.
Nous devions toujours répondre aux besoins des États membres parce que les besoins de la santé par la population n'a pas fait une pause parce qu'il y avait une crise.
La santé de nos populations, c'est nous qui devons la financer.
Let us work with purpose, work with solidarity, and work with the confidence that together we can build a healthier, stronger, and more prosperous Africa.
The journey ahead of us is big, and Africa can do it when we work together.
It is a great honor to welcome you to this high-level ministerial dialogue ahead of our 76th session of the WHO Regional Committee for Africa. This is particularly meaningful for me as it is only my second regional committee as a regional director following the RSC 75 in Lusaka last year.
If we want health security, we must buy African, regulate African, and trust African.
We cannot achieve or sustain local manufacturing by just building factories. We need an ecosystem, and everyone has said it, that will ensure that the manufacturers have the confidence to invest. If the regulator is not strong, then the investment can become a wasted investment.
Honorable Ministers, all, we're about to start, so kindly take your seats.
Okay, English pause, test, English pause. English pause.
Of WHO, distinguished delegates, we shall now proceed to the consideration of Agenda Item 6, Annual Report of the Regional Director on the work of WHO in the African region, which will be taken one after the other, with Agenda Item 5, A New Era of Health for Africa, United Action for Vision 2035. For this agenda items, please refer to document AFR RC 763 and documents AFR RC 7611 and AFR RC 7611 add 1, respectively. I invite the Regional Director, Dr. Mohamed Janabi, to present the annual report. Dr. Janabi, you have the floor.
Honorable Chairperson, Honorable Ministers of Health, Excellencies, representative from African Union Commission, partners, colleagues, and friends. I really would like to start by thanking the government and the people of Ethiopia for welcoming us to Addis Ababa for the generous hospitality extended to the committee. The report before you covers 12 months, meaning the 1st of July to the 30th of June, 2026. I could summarize the entire year in a single sentence: the funding landscape changed, and the regional kept delivering. So everything I'm going to say in the next few minutes expands on this one sentence. Next slide, please. So the story is in 5 steps. Let me start by the first. Okay. The first forces that shaped the entire year. The second one, how our countries and WHO responded. And third, what the responses achieved. And the fourth one, where the challenges remain. And finally, I'm going to discuss where we go from here. Every figure I use comes directly from the report before you. And part 1, the forces that shaped the year. But the 5 external forces which really converge to shape the environment in which our health systems had to operate was development assistance for health fell by about 1/5 between 2024 and 2025. Across the region, if you round it up, is almost 13 million people were displaced, 167 million people faced food insecurity, and only 38% of our populations are online, limiting access to digital services, data, and the entire innovation which we talk every day. At the same time, a new global health landscape began to emerge. These pressures did not arrive one after another, honorable ministers. They arrived together, placing an additional strain on a health system that were already under pressure. They also fell on workforce that stands, our total workforce in Africa today is 46% of the entire regional needs. In other words, fewer than half the health workers required while responding to 5 major pressures simultaneously. Of course, the 5 forces, one shaped almost everything that followed. Development assistance of health fell by 21%. The single largest donor of ours reduced its contribution by 67%, with Sub-Saharan Africa, as usual, absorbing the largest regional share of the reduction. So those cuts came at a time when government across the regions was spending on average 7.3% of the public expenditures on health, around half of the Abuja Declaration, which was 15%. Honorable ministers, head of delegates, this is not a temporary disruption from which we will simply return to business as usual. The assumption that shaped the global health financing for many years have changed. So our planning must change with them. I think the way to look at it in what mechanism can we use? So faced with this changed financing landscape and simultaneously shocks, countries chose to respond rather than to retreat. 4 changes help protect the frontline services. Resources were directed where needs were greatest, using routine data to guide decisions at a district level. Vertical programs were integrated into primary health care, making better use of the resources which were then available. Our governments began replacing part of the lost extended funding through domestic financing measures, including tobacco taxation, which you heard from yesterday. So WHO and the Ministry of Health also redesigned the way we work so that more resources reach services delivery. Perhaps the strongest example came from member states themselves. I'll give you data here. 26 countries reached 26 countries replaced 3 separate financing requests for HIV, tuberculosis, and hepatitis with a single integrated plan. That design reduced duplication, strengthened the national ownership, ensured that reform can make one support more effective. So one way to understand this year is to look at each challenge alongside the response it inspired. Reduce external financing, accelerated domestic resource mobilization, greater program integration, and the WHO invested round. A workforce operating below half the level required, what was required was matched by a more linear regional office, with 3/4 of our staff now based in your respective countries. Concurrently, emergencies were met with faster detection and response. Climate and food shocks were matched by climate and health investment pipeline, worth almost $139 million across 21 member states. And a changing global health landscape was met with the stronger African institutions and a greater regional cooperation. None of these changes happened by accident. They reflect deliberate decisions by member states and by WHO to protect essential health services while preparing for a different future. If I may pause here for a second, honorable ministers and head of delegations. I know all of you are politicians. At home, these things sometimes you don't talk about them much. But we are talking here with evidence of data. So let me turn now to what these efforts achieved. I have chosen 8 results that speak to the outcomes for people rather than list of activities, because there's a huge difference here. I could have presented activities which will not reflect the true picture. So together they show what countries were able to protect and advance during a year of exceptional pressure. Let's talk about elimination. The first is disease elimination. 8 of our member states reached elimination milestone this year. Proof that sustained national investment can still deliver historic gains under physical pressure. These achievements are the product of sustained investment, strong national programs, and the persistence of health workers and communities over many years. Second, the health security. 7 out of 10 of our 7 out of 10 outbreaks were detected within a week, within 7 days, and surveillance completeness rose from 70% to 94%. We can pick the diseases faster. That means early warning signs, faster actions, and better protection for communities. The Ebola outbreak last year, you all remember, in Bulape, was contained in 88 days, slightly less than 3 months. But the report is equally clear about where challenges still remain. As it was being finalized, the Budibunyo Ebola outbreak was still spreading with no licensed vaccine and no licensed treatment available. That realities underlines why continued investment in preparedness and rapid response is essential. If I may give an example, before coming here just last week, I was in Central Africa Republic, Bangui, with 4 other ministers, minister from Democratic Republic of Congo, minister from DRC, minister from South Sudan, and minister from Uganda. All of us, we said Africa must shift from response to preparedness. So we went to the field because, as you know, Central African Republic now is in an outbreak of cholera. We sailed in River Bangui with all the ministers. We look on the borders of the two countries, which literally is just a map. Otherwise, those people live together. When I look on another indicator, maternal and newborn health, which is the third indicator, maternal and newborn health, in May 2025, Botswana advanced to the gold tier on the path to eliminating mother-to-child transmission of HIV. It is the first high-burden country anywhere in the world to reach that milestone, showing that ambition targets are achievable when service reach mothers and the newborns consistently. And I should say, congratulations, Botswana. The fourth, severe non-communicable diseases. PEN Plus is bringing care for type 1 diabetes, sickle cell disease, and rheumatic heart disease closer to where people live through the first level hospitals. Rwanda became the first member state to achieve national PEN Plus coverage. Congratulations, Kigali. And thank you. And in June, the third International PEN Plus conference in Tanzania showed that this is no longer a pilot model, but a growing regional movement to bring life-saving chronic care closer to the people. And the fifth, a healthier population. 15 member states introduced progressive tobacco taxation reforms this year, the largest wave of reform in a decade. In Ghana, cigarette consumption fell by roughly 1/3, while excise revenue increased. Congratulations, Accra. This shows that well-designed public health policies can reduce diseases while strengthening domestic resources for health. And the sixth and seventh results concern whether WHO itself is changing fast enough to match a new reality. Because if we are asking you member states to respond to a new financing reality, what about we? So charity starts at home. So what did you do? So we therefore undertook the most extensive redesigning of the regional office in Brazzaville in more than 2 decades. Technical clusters were reduced from 6 to 4. Director posts fell from 9 to 6. Team lead posts, we moved from 49 to 33. Overall, it's very unfortunately, staffing was reduced to 23%, meaning WHO last year we had 2,540 staff. We had to go down to 1,948, a reduction of 502 staff. The point is not simply that we reduce numbers. It is that we shifted resources and presence closer to the country delivery. Those resources were reinforced to country delivery. By January this year, all our 47 offices had transitioned to a new core country office model, which is COM, and 3/4 of, which is 75% of our staff, were based at the country level where they can support member states most effectively. So as I speak now, honorable ministers, head of delegation, we have moved staff from Brazzaville. It's just 25% of us who are in Brazzaville, and I'm always with you there, so maybe just 24 are in Brazzaville. So the eighth result is the African growing influence in the global health. We didn't sit on the passenger seat. This year, African countries helped shape decisions that will have lasting consequences. We all recall the pandemic agreement was adopted, including the pathogen access and the benefit sharing system secured through leadership of the African group, which you represented us. The African Medicine Agency, AMA, became operational, strengthening our collective capacity to regulate medical products across the continent. And if I may pause for a minute, really we have to support our sister Mimi Daka. She's doing a tremendous job, and we are close to her. A big applaud to her. The Lusaka Agenda Roadmap was also endorsed, aligning partners more closely behind our country priorities. So together, these developments show that Africa is not only adapting to a changing global health landscape, it is helping shaping it. So the region did not ask for a seat at the table, it helped redesigning the table. So we really redesigned the table instead of only asking for a seat. Honorable Minister, a report that contains only good news would not absorb your confidence. I know till now we've been just talking about good news. We had our hip up and down. Progress has been made, but important challenges still remain. The first is financing. The gap now stands at almost US dollars $622 million, and in 35 member states, out-of-pocket spending has risen above the hardship threshold. People are selling their livestock. So for too many families, paying for healthcare still means using savings, selling assets, selling their lands, or taking a debt. So closing the gap, we require stronger domestic investment, a broader support for investment round, and a steady path towards the Abuja commitment. Now, for Abuja commitment, Honorable Minister, I think we should take it with a pinch a little bit, because committing, let's say 15% or 10% or 3% is one thing. How do you use that 15%? That's a completely different software. Second, the emergency threat has not gone away. Last year, we had 148 outbreaks. In our continent, the Budibunyo Ebola outbreak is still active, and cholera reached a record of 200 and almost 50,000 cases this year. Now, for Ebola, Honorable Ministers, I know you might be asking, what is happening with it? Maybe I should just, Budibunyo, this is his third time it's coming. The first time was 2007 in a district called Budibunyo in Uganda. This is where the name comes from. The Uganda surge team was strong, they contented it. 2012, it came in East Congo, in Beni. The DRC team, public health, was strong, it contented. This time it came different. Our sequences shows it started in February, meaning it went almost 4 months without us knowing. It was treated as malaria, it failed. Treated as typhoid, it failed. Misinformation started, maybe it's poisoning, maybe it's that, it failed. So around April, when there was an alert from a social media that people are dying here, because in between there, they tried to use a kit, but that kit was for Zaire strain, which was also negative. So when the sample was taken to Kinshasa at Professor Muyembe lab, this is where the Budibunyo now was picked. But it was already too late, and this time around, it crossed the border to Uganda. So Uganda had imported it from DRC. So that is one. Two, we are really having a big question. Why is it multiplying more faster than the last 2 times when it came? So we are trying to develop that research and see what can we do. The third thing, once it has crossed the border, this is why on the 16th of May, we had to announce it as public health of emergency. So we have put the countries, so those are the main 4 reasons. And of course, when you top it up now, we don't have a vaccine, we don't have a licensed therapeutic, it becomes really a challenge. But we are going to give you more details. We have a session of Ebola, which is going to come tomorrow or day after tomorrow. So all this underline that health security depends on the strong health system, safe water, and sanitation and coordinated action across the sectors. The third thing, the services that depend on sustained human contact experience some of the greatest, these are some of the greatest setbacks. Mental health was going among them. Rebuilding those services will require deliberate investment over time. And finally, we'll still not have a very clear picture who is being left behind. 44 of our 47 member states have a limited cause of death data. And this, honorable ministers, really, it's something we have to, because if I just cite an example, how many countries today we have birth certificates, more than 50% of our population? How many of our member states you have death certificates for? So those data, and this is why we really thank Susan Buffett Thompson Fund on looking on data. It was touched yesterday, honorables. If we don't have our own data, they will look on estimation, and which usually is not the most correct. By June 2027, every indicator should be disintegrated by sex and age so that resources can be directed where they are needed most. I would rather acknowledge where our evidence is incomplete rather than rely on averages which we are given. So this is a part of our annual report, and what I would say, the report also looks beyond the past year. It sets a direction for a decade ahead, framed around 3 horizons. The first is 2027. Our immediate priority is to stabilize, bring the Budibunyo outbreak under control, manage the financing transition, and agree country compacts that define our clear priorities and responsibility. The second horizon is 2030. By then, we should be scaling what works, expanding Pen Plus, strengthening family health teams, increasing regional manufacturing and financing, and a larger share of health expenditure from domestic financing. The third horizon is in 2035. Our ambition is an African that increasingly financing governs and delivers its own health agenda, supported by strong institutions, capable workforce, and resilient health system. So these horizons build on one another. The decision we take now will determine how quickly we move from one to the next. What is the biggest ask? That brings me to 3 commitments we must make together with you, Your Excellencies. First, finance predictability. So each country should set a credible funded path towards the Abuja target, and every commitment should translate to timely disbursement. Second is to try to align behind country compacts, one national plan, one reporting framework, and one very clear accountability for results. And the third one is to invest in African capacity, strengthen institution, workforce, regional manufacturing, and regulation so the continent can finance, govern, and deliver more of its own health agendas. I've got 4 messages to you. As I conclude, I hope there are 4 messages that stay, which I wish to stay with us. First, countries have shown that progress is possible even in a period of exceptional financial pressures. Second, we have shown today's emergencies demand today's action. We cannot use 20th century solution to try to tackle today's problem. The Budibunya outbreak requires our sustained attention until it is brought under control. And third, WHO has demonstrated that it is prepared to reform, but efficiency alone cannot replace sustainable financing. And finally, honorable ministers, the long-term answer lies in a stronger regional institution, greater domestic investment, and Africa's growing capacity to produce, regulate, and deliver the health services our people need. Those are the choices that will really determine the next chapter of health in our region. In closing, Honorable Chairperson, Honorable Ministers, this annual report is ultimately an instrument of accountability, an account for what we achieved together, where progress fell short, and how WHO has adapted itself to member states. I would really now welcome your reflections when I give the chair back to the chairperson, including the priorities you believe require greater attention and how WHO can support countries more effectively in the year ahead of us. When we did a talk yesterday, honorable ministers, head of delegations, at WHO Afro, when we say walk the talk, we really mean walk the talk. So whatever is going to be recommended here, please hold me accountable when we come back next year. With that, I conclude my presentation and look forward to your comments, discussion, and please just don't tell us nice things. We know them. Tell us where we went wrong and where can we improve. I thank you. Back to the chair.
Thank you, Dr. Janabi. The floor is now open for comments from member states on the regional director's presentation. You can raise your flag and you'll be taking your stage. So I'll start with Kenya. You have the floor. Followed by Sierra Leone. Kenya, you have the floor.
Thank you, Honorable Chairperson, Dr. Mohamed Janabi, WHO Regional Director for Africa, Honorable Ministers and Heads of Delegation. Kenya thanks the Regional Director for the report that he has just presented and commends the government and the people of the Federal Republic of Ethiopia for their warm hospitality. Kenya fully endorses a new era of health for Africa, United Action for Vision 2035. We took part in its development. We recognize our own reforms in its 4 strategic priorities, and we support the recommendations in paragraph 19. Chairperson, allow me 3 points. 1, financing and sovereignty. The era of externally financed health system is closing. Whether or not we are ready, Kenya has chosen to be ready. Through the Taifa Care under the Social Health Authority, 32.4 million Kenyans are enrolled. Primary health care is funded from our own budget, and the financial protection is a legal entitlement rather than a promise. But domestic resource mobilization is not a slogan. It demands physical space and credible investment cases. So we ask the regional office to strengthen the country capacity for financing reform and to convene ministers of health together with the ministers of finance, because that is where these decisions are made. Second, manufacturing and pool procurement. Kenya has ratified the treaty establishing the African Medicine Agency, and we urge member states that have not yet done so to ratify without further delay. A continental regulator without a continent behind it cannot shape a market. We ask the regional office to accelerate the pool procurement and joint regulatory approvals under Flagship 6 so that African manufacturers have the predictable demand that investment requires. Sovereignty in health products will be built by purchase orders, not by declaration. Thirdly, digital transformation and data. Kenya Digital Health Superhighway now links facilities, claims, and registries on a single national architecture. And over 107,000 community health promoters Carry that system into households. Our lessons is simple. Digitize the system, not the pilot. Kenya supports the proposed regional data hub and asks that it rests on interoperability standards and on data governance that member states own and trust, including African sovereignty over African health data. Chairperson, a strategy is judged not by its language, but what changes in a district hospital. Kenya therefore asks that the result framework be published with baselines, targets, and annual reporting to this committee, so that in 2035, we're able to say with evidence what this new era delivered. Kenya stands ready to work with the regional director, sister member states, and supports the adoption of this strategy. I thank you, Chairperson, and thank you all.
Thank you, Kenya. Senegal, you have the floor, followed by Burundi.
Merci beaucoup.
Thank you very much, Chairperson. Senegal congratulates the regional director upon the presentation of his report on the work of the WHO in our countries. Having achieved ML3 for medicines, and in relation to the vaccine programs, on behalf of Senegal, I would like to renew our commitment to work hand in hand with the WHO. The goal being to increase the ability to manufacture medications locally. We also remain committed to strengthening the regulatory framework in the WHO Africa region. When it comes to emergencies, health emergencies, we welcome the support of the WHO when it comes to the response to recent epidemics. We recommit to strengthening Africa's voice in the Intergovernmental Working Group on Pandemic Treaties. And when it comes to mercury-related diseases and depigmentation, Senegal is proud to be one of the first countries in Africa to implement the Minamata Convention when it comes to dental amalgams. And I would also like to thank the WHO for their support to Senegal when it comes to the certification and that we received. Senegal has continued to support, to add its contribution to the work of the WHO, and was also committed to flexible, sustainable, and predictable funding of our organization. Senegal is undertaking in reforms, and we also welcome the reforms done by the WHO. We have continued reforming our system and will continue to do so in the years ahead. Thank you.
Thank you, Senegal. Burundi, you have the floor.
Madam Chair, Regional Director, ladies and gentlemen, distinguished delegates, on behalf of Burundi, I would like to congratulate the Regional Director upon his report. It shows the resilience of our region. It shows that significant efforts have been made to protect our people's health in a context which is particularly complicated. Burundi recognizes itself in this, despite the constraints that our healthcare system faces. And we say this, for example, displaced populations in the humanitarian context of our region. Burundi will continue to support efforts made to strengthen healthcare systems and to strengthen health sovereignty. This is very important in order to construct resilient healthcare systems and to ensure that access to healthcare is equitable, especially for displaced populations. We are particularly happy to see that in the period under consideration, we have made progress when it comes to, for example, the polio virus. And when it comes to vaccination, Burundi has taken steps to implement the HPV vaccine in all of its facilities. This is a campaign, and we have achieved 88%. And this shows that our government is committed. We are currently preparing to take a new step when it comes to further vaccinating against HPV, and we aim to eradicate it sustainably and once and for all. So Burundi is committed to accelerating the implementation of its investment plans with the support of the WHO and partners. We will continue to pursue reforms, the goal being to increase the health of our people. Over the next few years, our priority will be to strengthen our ability to respond to emergencies. This includes epidemiological surveillance. We will also be paying particular attention to women's health, children's health, and other vulnerable populations. Burundi reaffirms its commitment to UHC and a new era of health for Africa. Finally, we welcome African and global solidarity. This is very much required when it comes to when you think about the need for funding and financing. We must make sure that the progress made is not lost because of a lack of external funding. So Burundi is continuing to make healthcare a vital part of its programs and plans, especially when it comes to funding. Thank you.
Thank you, Burundi. Burkina Faso, followed by Ghana.
Madam Chair, dear delegates, Burkina Faso takes note of the Regional Director's report, and we congratulate Dr. Janabi for his leadership at a time where his leadership is particularly required. We welcome emphasis placed on health emergencies, strengthening of healthcare systems, domestic funding, and local manufacturing. Burkina Faso also is very grateful to the Regional Director for his participation in the first edition of the National Forum on Funding Healthcare. This took place in March 2026 in Ouagadougou. The fact that you were there and the fact that you made contributions shows how committed the WHO is to countries which require sustainable and sovereign funding. And when it comes to the leadership of our head of state, Captain Traoré, we as Burkina Faso are continuing to pursue a resilient, inclusive, equitable, and sovereign healthcare system. We have therefore allocated 12% of our budget to healthcare. We've also been recruiting and healthcare workers and improving education for nurses, doctors, and other healthcare workers. We've also made progress when it comes to reducing malaria cases and associated deaths. Essential healthcare services has also benefited from support. This means that more and more women and children are benefiting because they have been the focus of those efforts. We've also ensured that patients with renal insufficiencies have received extra support. We have made sure that pregnant women and children under the age of 5 have access to healthcare at no cost. Madam Chair, given that external aid is reducing, we call for strengthening of domestic funding in South Africa. We also want to see increased local manufacturing and more resilient healthcare systems. We encourage the WHO to continue to support member states in this area. Thank you.
Thank you, Burkina Faso. Ghana, you have the stage.
Thank you, Madam Chair. Ghana thanks the Regional Director, Dr. Mohamed Janabi, for his comprehensive report and commends his leadership during a period of significant health economic, and geopolitical challenges. We welcome the vision of building a healthier Africa together and the progress made towards universal health coverage, health security, and greater health sovereignty across the region. We particularly appreciate the regional office support to member states in responding to public health emergencies, strengthening preparedness and surveillance, advancing digital health, promoting local production, and advocating for sustainable health financing. The Regional Health Data Hub, the African Health Workforce Agenda 2026 to 2025, and the Accra Reset are important milestones in advancing African-led solutions. Ghana is proud to contribute to this agenda. Under the leadership of His Excellency President John Dramani Mahama, the Accra Reset Agenda is driving health sector transformation through stronger primary health care, improved health financing, digital transformation, enhanced health security, and more resilient health systems. We welcome the regional office recognition of the Accra Reset as a platform for strengthening country ownership, domestic resource mobilization, and health sovereignty. Ghana also welcomes progress in digital health, including interoperability and data integration, and looks forward to the Regional Health Data Hub, strengthening regional intelligence and evidence-based decision-making. We further welcome efforts to advance local manufacturing and regulatory capacity. Ghana is pleased to maintain a WHO-recognized maturity level 3 regulatory system through the Food and Drugs Authority, while continuing to strengthen pharmaceutical manufacturing capacity. Chair, despite these gains, declining development assistance, health workforce migration, climate-related emergencies, and growing demands on health systems remain concerns. We therefore support continued efforts to strengthen domestic financing, workforce development, regional cooperation, and sustainable investment in health. Ghana commends Dr. Janabi and the regional office for the progress achieved during his first year in office and reaffirms its commitment to working with WHO, member states, and partners
Ghana.
towards the realization of Vision 2035. Thank you, Madam Chair.
Thank you, Ghana. Niger, followed by Ethiopia. Niger, followed by Ethiopia.
Madame la Présidente,
Madam Chair, Regional Director, ladies and gentlemen, ministers, distinguished delegates, Niger congratulates the Regional Director for the report, especially in the backdrop of the challenges that our region is facing over the period in review. This report has highlighted healthcare sovereignty and shows that we therefore need more robust healthcare systems. We need to increase manufacturing capacity at a regional level. We also need more active African leadership and more resilient funding when it comes to the implementation of healthcare priorities. And this is the battle horse of every member state. The goal is to ensure our healthcare systems are more sustainable. And over the period in review, the African region has been faced by several different healthcare emergencies. These include epidemics such as Ebola in the DRC. And we'd like to take the opportunity to send a word of encouragement and support to the DRC when it comes to that fight against Ebola. And besides the Ebola outbreak, our countries have also faced outbreaks of measles, diphtheria, meningitis, and cholera. As for Niger, besides the work done in this report, efforts have also been done to improve access to healthcare via improving healthcare coverage. We've also strengthened the technical setup of regional and tertiary healthcare centers and facilities. This includes better equipment, and it shows that at the very highest level in our country, there is the required political commitment. Finally, Niger approves this report and encourages the regional director to maintain this effort. Thank you.
Thank you, Niger. Ethiopia.
Madam Chair, distinguished delegates, on behalf of the government and peoples of Ethiopia, it is my privilege to welcome you to Addis Ababa. We are honored to host this session. Ethiopia congratulates the regional director on his first annual report, candid accounts of difficult years of international health fund felt sharply. The regional absorbed disproportionate share of the reduction, and also major burdens such as malaria, new HIV infection, workforce shortage, and recurrent cholera cases persistently. Those results were still delivered deserved recognition, including uninterrupted HIV treatment for 21.7 million people, major elimination of milestones in 8 member states, rapid outbreak detected in 71% of cases, and secretarial reforms that moved more staff closer to country. Ethiopia commands the regional director and the secretariat for holding the line. Chairperson, the report opens with Ethiopian Marburg virus disease outbreak, 40 confirmed cases and 9 deaths. Each represents family who lost loved ones. We are grateful that WHO activates its response with 24 hours, deploys and repurposes experts and staffs, and supports every pillar of response, including mobile laboratory to Jinka. The report highlights highly notes that this speed was enabled by Ethiopian peer investment in preparedness in laboratory, surveillance system, trained surge of teams, and emergency operational centers built before the outbreak. 90 days of containment achieved on years of investment, often made when emergency was visible. The same lesson runs those Ethiopians other contributions recorded in the report. Integrated measles vaccine with vitamin A and nutrition screening, solar power for health facility, and steady gain in maternal care with facility delivery rising from 37% to 62%, and skilled birth attendance from 37% to 64%. These are the compound returns of sustained investment.
Ethiopia. Asking you to finish. Okay. Carr, followed by Camoros. Thank you.
Madam Chair, the Central African Republic thanks the Regional Director for his report. We welcome the progress made by the WHO in the region, especially when it comes to the implementation of UHC and the strengthening of emergency response systems. We also welcome good collaboration with member states. On agenda item 15, we would like to focus on something there which is very important to us and the strategy. The F5 program rightly sees modernization of WHO institutions as important, and we think that the same level of ambition should be carried on when it comes to domestic health institutions, especially the ministries of health. And we say this because it will be hard to construct resilient healthcare systems and to accelerate the implementation of UHC and to strengthen health sovereignty without ministries of health having the necessary institutional capacity when it comes to planning and coordination, financing, regulation, manufacturing, and the use of data. This also includes human resources. And so we think that Program F5 should be strengthened by another aspect which will be dedicated to the modernization and strengthening of domestic ministries of health under the leadership and appropriation and ownership of governments as well. We also call on the WHO to develop joint tools which will allow countries to evaluate their institutional maturity levels and to progressively implement their roadmaps. And we are what we are thinking is quite simple. We need a modern WHO which supports member states who have modern healthcare systems, and we therefore need ministries of health which are very much capable of doing so. We fully support the strategy which has been proposed, and we encourage the regional office to include in this work what we've suggested. Thank you.
Thank you, Car. Comoros, you take the floor.
Okay. Merci.
Thank you, Madam Chair. Madam Chair, Regional Director, ladies and gentlemen, delegates, we thank the Regional Director for his excellent report. We congratulate the entire Secretariat for the work that has been done and the progress made despite the difficult financial situation and in the face of healthcare emergencies. We welcome progress made when it comes to UHC, when it comes to preparedness, and when it comes to strengthening of healthcare systems, as well as efforts to further digitalization. Now, these priorities correspond to our domestic priorities in the area of health. Regional Director, we welcome the support that you have offered to SIDs in the African region. Many projects have showed that they have a high level of value when it comes to accessibility to healthcare systems. And SIDs are not only a geographical phenomenon, it also has very much to do with access to healthcare, to equipment, and to healthcare workers. It also has to do with costs. Now, climate change is only increasing our vulnerability. We're seeing floods and disruptions to supply chains. This has simultaneously affected healthcare structures. It also harmed the availability of healthcare equipment and medication. This is why Comoros is particularly concerned. We have just been affected by Cyclone Chido, and therefore we call for increased efforts to include the specific requirements of SIDs in our regional programs. We would like to see more engagement with SIDs and wider member states when it comes to improving resilience of SIDs to health emergencies. Thank you.
Thank you, Comoros. Tanzania, followed by Botswana.
Thank you, Madam Chair. The United Republic of Tanzania expresses its appreciation to the Regional Director for the comprehensive report outlining the achievement, challenges, and priorities of WHO in the Africa region. Tanzania welcomes the ongoing efforts to strengthen WHO through global health architecture reforms. We emphasize that these reforms should reinforce WHO's core mandate as the leading global health technical authority, particularly in setting norms and standards, providing evidence-based guidance, coordinating international public health action, and supporting resilient health systems. We commend WHO's leadership in coordinating the African region engagement in implementation of the International Health Regulation 2024 amendments and the finalization of the pathogen access and benefit sharing annex to the WHO pandemic agreement. We encourage continued solidarity and we encourage continued solidarity and cooperation among member states to facilitate the timely operationalization of these important global instruments and to ensure equitable access to pathogen, data, and health technologies during future public health emergencies. Chairperson, Tanzania appreciates WHO's continued technical support in strengthening health systems, enhanced disease surveillance, responding to outbreaks, advancing universal health coverage, and improving maternal, newborn, child, and the adolescent health. We also commend the collaborative regional response to the ongoing Budubugo virus disease outbreak and the preparedness effort in neighboring countries. As Africa continues to face emerging health threats, climate change, antimicrobial resistance, and resource constraints, Tanzania remains committed to working closely with WHO, regional institutions, development partners, and fellow member states to build the resilience, equitable, and people-centered health system. I thank you.
Thank you, Right Honorable Chairperson. And let me, as a Botswana, congratulate the Regional Director for the comprehensive and insightful report that we have received. The report clearly states and captures the demanding healthcare landscape through which you operate, but we appreciate that you've done rather quite well, in a very difficult climate. And we also wish to thank you and all partners in this room for the work and the support that you've given us, which has led to the achievements that we've been able to attain, particularly with our prevention of mother-to-child transmission of HIV and AIDS. These achievements underscore the collective power that we have when we work together as member states and with our fellow development partners from across the world. And we also note quite dutifully that you have reported that there's a funding gap of $662 million, which we need to close. And as a country, we are pleased to report back that just last week we have passed our national health insurance policy as we are working towards ensuring that we can have greater sustainability with healthcare funding within the environment that we work in. We also note the data gaps that you have pointed out, showing that 44 out of 47 countries still lack reliable data on cause of death. These are gaps that we encourage that we be able to close. And Director of Ceremonies, Chairperson, I would also like to point out that as a continent, as you said, we should also say things that we need to do better. We need to look into inequality as a driver, of the burden of disease being shouldered by more over others right within continents, the gap between the poor and the rich, but also the regional or geographic gap within our countries. Lastly, we stand as a country ready to collaborate with the WHO and all member states to overcome the challenges, and we do believe that we will get it right as a continent. Thank you.
Thank you, Botswana. Angola, followed by Algeria. Angola, you have the...
Muito obrigado, Excelência Presidente da 76ª Sessão do Comitê Regional da OMS, Excelências Ministros da Saúde, Excelência Diretor Regional da OMS para a África. A delegação angolana agradece ao Secretariado pela apresentação do documento Uma Nova Era da Saúde para a África, Ação Unida para a Visão 2035 e manifesta seu apoio à aprovação deste importante quadro estratégico. Angola reconhece que a região africana enfrenta desafios complexos e interligados, incluindo surtos,
including climate change, accelerated urbanization, communicable diseases, and dependence on imported medical commodities. We commit to investing more to strengthen our health system so that they're more resilient and able to prevent, detect, and face emergency situations. We want to work to ensure that we achieve universal health coverage. Our vision is aligned with the priorities of Angola, as well as digital transformation, the improved human resources and sustainable financing of the health sector. The Angolan delegation deems it important to strengthen regional cooperation as well as regulatory harmonization, equitable access to vaccines, medicines, and other health technologies. We reiterate the importance of forecasting and partners that are aligned with national priorities as well as accountability mechanisms. The Angolan delegation approves this initiative and would like to work in close collaboration with the WHO to have an Africa that has better health and that is more resilient. Thank you, Madam Chairperson.
Director for its report on the work of the World Health Organization in the African region. In line with the achievements and challenges described in this report, I'd like to seize this opportunity to share important progress of my country in the field of health. Indeed, the policies pursued by Algeria have made this progress possible to achieve significant improvement in health indicators, including reaching a life expectancy of 80 years, achieving the Sustainable Development Goals related to maternal and child health, eliminating communicable diseases, as well as ensuring national needs for medicines, which local production covers more than 82% of the country's total pharmaceutical needs. Among other important achievements of my country, the World Health Organization has validated this year Algeria as having eliminated trachoma as public health problem. Algeria will remain committed to the values of the World Health Organization based on solidarity and equity by continuing to reform its health system through strengthening infrastructure, advancing digitalization, training human resources, and enhancing community-based healthcare, while attaching particular importance to prevention and maintaining free access to healthcare. In the same context, Algeria reaffirms that the right to health is a fundamental and inalienable right. Algeria also reaffirms its commitment to its African policy based on solidarity and shared development through effective health cooperation within a vision of South-South cooperation, notably through the Algerian Agency for International Cooperation for Solidarity and Development. Today, more than ever, we are called upon to strengthen collective action and consolidate mutual trust among African member states, because the decisions we make today will shape the future of African health security and enhance our capacity to confront crises, and in particular in the context of international community is facing unprecedented health challenges, including pandemics, geopolitical tension, climate emergencies, as well as inequalities in access to healthcare. Finally, I would like to reiterate the readiness of Algeria to share its healthcare expertise and experience, technical support, and medical training with other African nations to help build a more health secure continent. Thank you for your kind attention.
Thank you, Algeria. Uganda, followed by Lesotho.
Thank you very much, Honorable Chair and distinguished delegates. Uganda welcomes the report of the Regional Director on the work of WHO in the African region. This statement captures our collective ambition for a continent that is healthy, sovereign, and resilient. Uganda stands ready to contribute to this vision through concrete action. We commend the World Health Organization and the Regional Director for the great leadership during a time of significant global health and economic uncertainty. Uganda has once again demonstrated that African-led solutions work. Our successful containment of the recent Ebola outbreak with a case fatality rate of just 10% one of the lowest ever recorded, was achieved through early detection, rapid contact tracing, and coordinated national action. But Uganda's Ebola response went beyond our borders. We have deployed personnel across the border with the DRC and provided necessary support. This is the solidarity that our continent demands, a recognition that no country is safe until all of us are safe. Madam Chair, Uganda is safe and open to trade, tourism, and travel. We thank World Health Organization for its principled position against travel restrictions that harm economies without public health justification. Uganda is aligned with the WHO Vision 2035, which calls for an Africa which is self-reliant with healthy and well-nourished citizens, expanding access to quality health care, achieving universal health coverage, and reducing maternal, neonatal, and child mortality. Uganda is ready to lead by example. We have developed a national health compact, committing to health as a national priority. We are committed to investing in health, not only as a social imperative, but an economic one. A healthy population is the backbone of national development. Uganda therefore champions a bold, collaborative agenda to build resilient regional manufacturing capacity. Our vision is not of isolated national efforts, but of an integrated, innovative ecosystem. Uganda reaffirms its commitment to working with the World Health Organization and all member states and partners to ensure that no one is left behind. Finally, the new era requires a WHO that is fit for purpose. The financing gaps in the proposed WHO Afro program budget are unacceptable. This calls for strengthened assessed contributions, expanded flexible funding, and transparent reporting of resource gaps. We urge partners to align funding through government systems. This is how we build ownership and sustainability. Madam Chair,
Uganda.
I thank you very much.
Uganda, Lesotho, followed by Zimbabwe.
Chairperson, WHO Regional Director for Africa, Dr. Janabi, honorable ministers, distinguished delegates. The Kingdom of Lesotho congratulates you, Chairperson, on your election and thanks the government and the people of Ethiopia for their warm hospitality. Let me also congratulate you on exhaustive account of your first year in office and the strength through which you pushed for the new regional strategic plan to guide the next steps. We commend the regional director for candid and forward-looking report. It demonstrates that despite one of the most demanding periods in our region's recent history, Africa continued to deliver. Essential health services were maintained, several outbreaks were contained, tuberculosis mortality declined, and important disease elimination milestones were achieved. However, the report also makes clear that these gains remain fragile. Declining external assistance, persistent inequalities, shortages in healthcare workforce, weak supply chains, and recurrent emergencies continue to threaten our progress. Coverage is stagnating precisely where inequity is greatest, while many political commitments remain insufficiently financed. Lesotho therefore welcomes the regional director's emphasis on health sovereignty, strong national systems, sustainable domestic financing, regional manufacturing, and African leadership in setting public health priorities. The journey we are in today says to us that we cannot claim health sovereignty without financing our health system, acting as a collective through strategies such as pooled procurement, local manufacturing for efficiency gains, and equity across the region. The guidance and capacity building to help member states establish strong regulatory authorities as an enabling environment for local manufacturing through support of AMA is one of the giant steps taken. As a landlocked and geographically disadvantaged country, The Kingdom in the Sky faces higher transportation costs, longer supply routes, and delays in access to medicines, vaccines, and other essential health products. These challenges deepen existing disparities. Equity, therefore, must be reflected not only in the distribution of health products, but also in program design, resource allocation, procurement, arrangement, and supply chain planning. Lesotho stands ready to contribute to collective endeavor. I thank you.
Thank you, Lesotho. Zimbabwe, followed by Zambia.
Thank you, Chairperson, distinguished guests, ladies and gentlemen. Zimbabwe congratulates you, Chairperson, on your election to chair the Regional Committee. Zimbabwe welcomes the report of the Regional Director and commends Dr. Mohamed Janabi and his team for their continued leadership in advancing the health priorities of our region. Fiscal pressures, rising debt, and declining external assistance requires us to strengthen domestic resource mobilization and sustainable health financing. Zimbabwe supports the strategy for financing the future of health in the Africa region 2026 to 2035. We must move progressively from dependence to greater ownership. We must also protect our gains against communicable diseases. Outbreaks of cholera, measles, polio, Ebola, and other emerging diseases remind us that these gains remain fragile. Sustained investment in surveillance, immunization, laboratories, emergency preparedness is essential. At the same time, the growing burden of non-communicable diseases requires stronger prevention, early detection, and integrated management within primary health care. Zimbabwe further calls for greater attention to essential surgical, obstetric, and anesthesia care as a core component of universal health coverage. Timely access to safe surgery and emergency obstetric care can prevent avoidable deaths and disability. Regional solidarity is indispensable, and Zimbabwe remains committed to working through various regional structures to strengthen surveillance, food procurement, local production, and coordinated outbreak response. We strongly support Africa's drive towards local and regional manufacturing of vaccines, medicines, and essential health products. Zimbabwe reaffirms its commitment to these priorities. Together, we can build a healthier, more resilient, self-reliant, and equitable African region. I thank you.
Thank you, Zimbabwe. Zambia, followed by Togo.
Honorable Chairperson, Zambia congratulates the Regional Director on the comprehensive report and welcomes its emphasis on health sovereignty, resilient health systems, sustainable financing, and African leadership in determining our health priorities. The experience of recent years has demonstrated that Africa must strengthen its capacity to finance and sustain essential health services. Zambia therefore supports the call for member states to own, finance, and deliver their health priorities, including strengthening domestic resource mobilization and protecting primary health care, immunization, surveillance, and the health workforce. We also strongly support the Lusaka agenda and its emphasis on aligning development assistance with national priorities. Partnerships should increasingly be predictable, flexible, and coordinated around one national plan, one budget, and one reporting framework, rather than fragmented parallel programs. Zambia further supports accelerated action towards local production of medicines and health commodities, food procurement, stronger African medicines regulation, health workforce development, digital health, and resilient primary health care systems. Chairperson, we further commend WHO APRO for developing a draft regional framework and implementation strategy for safe surgical care. We recommend that the regional office continues to work with member states and support the efforts to deliver safe surgery for all our people. Zambia therefore supports the report and reaffirms its commitment to working with WHO, the African Union, and member states and all our partners to translate our commitments into measurable improvements in the health and well-being of our people. Thank you.
Thank you, Zambia. Togo, followed by DRC.
Thank you, Madam Chairperson. Togo would like to thank the Secretariat for the quality of the document that has been shared with Member States delegations. We agree with the RD on the key interventions that have been implemented: universal health coverage, emergency situations, and the integration for better coordination. WHO has been helping countries through vaccination campaigns, promoting mental health disease surveillance, and supporting them for health financing. Togo supports all these interventions in the National Health Policy of 2030 and the Health Development Strategy that was assessed this year with significant progress. However, given the diverse actions of public health coordination as well as rapid capacity building constitutes a major challenge for member states. We really laud the WHO for their interventions in health system strengthening and equity to better respond to the population's needs. Thank you, Madam Chair.
Thank you, Togo. DRC.
Madam Chairperson, Regional Director of WHO, Honorable Ministers, distinguished guests, Dr. Baudier, Permanent Secretary, will be taking the floor on behalf of the Minister who was not able to make it for this meeting. We congratulate the RD for his report and we buy into the strategy that the committee has planned. The DRC has been going through the Ebola virus outbreak since May. This 17th epidemic, Bundibugyo virus, has reached over 4,000 people. This is the reason why the minister, under the head of state, who is closely monitoring response interventions, have come up with one plan and one budget. Given the magnitude of this epidemic and its magnitude, we have a series of public health measures. We have innovative medical strategies, vaccination for increased protection for the combination of Zaire and Bundibugyo strains, so that we have increased protection. There are other therapeutic interventions to complete the panoply of responses. The medical response can not substitute public health measures that we need to scale up. This commitment is part of resilience and continued learning. So we have proven that our capacity to act and is good, but then we also need to look at our vulnerability. The current situation highlights the need for Africa to develop its own vaccines. We want cooperation throughout Africa as well as at the global level. We take this opportunity to warmly thank the WHO. The RD has come to the epicenter of the disease at least twice or thrice, and other partners have mobilized themselves, pulling together our efforts to target this 17th outbreak. We are protecting the DRC and the entire Africa as well as the whole world. We need to counter epidemics so that we have better health. Thank you.
Thank you, DRC. Namibia, followed by Chad.
Thank you, Your Excellency, Madam Chairperson. And at the outset, we wish to congratulate you on your election as chairperson for this RC. Namibia commends Dr. Janabi for the comprehensive report on WHO's work in the African region. We also commend the Secretariat for sustaining essential services, notably keeping 21.7 million people on uninterrupted HIV treatment and controlling concurrent outbreaks despite facing the sharpest health financing contraction in 20 years. This report starkly illustrates that while our regional resilience is growing, evidenced by faster outbreak detection and major disease elimination milestones, our foundational health systems remain vulnerable. The ongoing public health emergencies, compounded by climate-induced shocks and severe external underfunding, demand an urgent, unified response. We welcome the regional office's bold internal reforms, successfully transitioning to a leaner, country-focused operational model that brings crucial technical support closer to communities. However, a structural financing reset requires a structural response. Therefore, Namibia issues a strong call to action to all member states and global partners. Firstly, we must aggressively prioritize domestic resource mobilization. We call on member states to accelerate progress toward the Abuja Declaration's 15% target to safeguard primary health care, protect vulnerable populations, and sustain our critical health workforce. Secondly, we urge partners to honor their commitments to the WHO investment round, urgently converting sovereign pledges to rapid, predictable disbursements to close the remaining core funding gaps. Thirdly, we must firmly entrench our health sovereignty agenda. We call for intensified investments in the local manufacturing of medical countermeasures and vaccines, ensuring Africa is never again left vulnerable to global supply chain disruptions. In closing, Namibia remains fully committed to working closely with WHO to secure a healthier, self-reliant future for the African region. I thank you.
Thank you, Namibia. Chad, followed by Guinea.
Madam Chair, Regional Director, Ministers, distinguished delegates, Chad is honored to take part in this session, and we thank the people and authorities of Ethiopia for having hosted us. Chad congratulates the members of RC 76 who have been elected to their leadership positions, and we welcome the report that has been proposed. We think that it is clear and it is honest. It also shows that the year that has gone by has been an exceptionally challenging one. In fact, it will go down in history. It has been characterized by several different epidemics at the same time. Chad recognizes itself represented in the report because we have the same challenges expressed in the report. However, despite the difficult context, it is very important to maintain essential services, the way we respond to health emergencies, and our efforts to eliminate diseases. Chad commits to continuing to collaborate with the WHO and further partners when it comes to fighting these different challenges all while preserving its health sovereignty. It also is committed to increasing manufacturing capacity. Just to let you know, Chad has joined a list of countries which aim to further local manufacturing, and progress is being made. We've been working notably with the CAR in this context. So it is thanks to the support of many that we continue to work hand in hand with various different partners to better operationalize the AMA. And Chad notes this report and reaffirms its willingness to make its contribution to the strengthening of health sovereignty on our continent. This is a challenge, but it can be overcome. Thank you.
Thank you, Chad. Guinea, followed by Mauritania.
Madame la Présidente,
Madam Chair, distinguished delegates, on behalf of the Minister of Health of Guinea, I would like to firstly warmly congratulate the Regional Director for the clarity of this report. Despite the historic reduction in international aid, what we can say is that we have managed to maintain our capacity levels. We are particularly glad to see that efforts have been continuing when it comes to eliminating sickle cell disease as a public health issue. And this progress has been made following 20 years of sustained efforts. And we have done so using committed communities, data, sustained efforts. And so we are getting close to also eliminating malaria. However, what this report also shows is that we need to take heed of a warning. Resilience is still fragile. The lack of funding, the lack of healthcare workers, the fragmentation of programs, and information system deficiencies are compromising the efforts, the progress that has been made. And this is why Guinea fully supports the Vision 2035. We think that we should continue to implement it. And it is from this perspective that we are calling for a focus around several priorities, including strengthening primary healthcare, secondly, protecting the essential function of healthcare, and then thirdly, coming up with credible mechanisms for domestic funding, hand in hand with partners, in order to achieve national priorities. Therefore, WHO's efforts must also be translated into an increased presence in member states, within member states, so that we can produce measurable results. Guinea reaffirms its commitment to working hand in hand with other member states in order to continue making progress. This is not just an ambition, but we want to make what we're talking about here a tangible outcome. Thank you.
Thank you, Guinea. Mauritania, followed by the Gambia.
Merci.
Thank you. Firstly, I would like to thank Madam Chair and congratulate you on your brilliant election. And I would also like to welcome the work done by the Secretariat and that of the Regional Director. Regional Director, we welcome this report. It is telling us that there is a new trajectory to be followed for our region, which takes advantage of health sovereignty, national capacity levels, and others. Now, this report has brought up several different lessons for our continent. For example, we need to increase domestic financing. We need to invest more in human resources. We need to be better prepared for epidemics and health emergencies. We need to develop African manufacturing capacity. We need to strengthen healthcare systems and ensure that everyone has access to it. Mauritania identifies with these main points. We are very much committed to investing in human resources, increasing capacity, increasing accessibility, and also increasing access to essential medicines. We also are making progress when it comes to digital transformation of the health sector. All of these efforts feed into a vision of Africa being more sovereign, more resilient, and more capable of responding on its own strength to health emergencies. Thank you.
Thank you, Thank you, Mauritania. The Gambia, followed by Sao Tome and Principe.
Chairperson, Regional Director, Honorable Ministers, distinguished delegates. The Gambia commends Dr. Mohamed Yakub Janabi and WHO AFRO for developing a new era of health for Africa, United Action for Vision 2035. The Gambia fully supports this bold and transformative vision, which recognizes health as a strategic driver of sustainable development, resilience, equity, and regional sovereignty. We welcome the consultative and country-driven approach used in preparing this framework and appreciate its alignment with Agenda 2063, the Sustainable Development Goals and the aspirations of African member states for stronger, more resilient, and self-reliant health systems. The Gambia agrees that Africa is at a pivotal moment. Rapid population growth, urbanization, climate change, recurrent disease outbreaks, and the rising burden of non-communicable diseases are placing unprecedented pressure on our health systems. At the same time, constrained fiscal space and uncertainty in external financing require new approaches to health investment, service delivery, and partnerships. The Gambia has made progress by strengthening primary health care, expanding access to essential health services, maintaining high immunization coverage, improving maternal and child health programs, and enhancing disease surveillance and outbreak response capacities. Additional investments in laboratory services, emergency preparedness, community health systems, health workforce development, and digital health have enhanced resilience and data-driven decision-making. Despite these achievements, significant challenges remain, including health workforce shortages, limited physical space, increasing demand for services, climate-related health risks, the growing burden of NCDs, dependence on imported medicines and health technologies, and gaps in digital infrastructure. Addressing these priorities will require stronger domestic resource mobilization, increased investment in human capital, expanded digital health infrastructure, and enhanced regional cooperation. We therefore call upon WHO, development partners, and regional institutions to continue supporting member states in implementing the flagship initiatives and strengthening country ownership of health sector reforms. The Gambia fully endorses a new era of health for Africa, United Action for Vision 2025, and supports the adoption of the related resolution. Thank you.
Thank you. The Gambia, Sao Tome and Principe, followed by Mali.
Excelentíssima Senhora.
Madam Chair, Your Excellency, Regional Director, Your Excellency, members, rather, dear ministers, I would like to thank firstly Ethiopia for your hospitality. Regional Director, we welcome the report that you have presented and your leadership. Indeed, I think that we all know that we are aware of our weaknesses. And the challenge is how to achieve our potential. I am particularly happy to see that so many countries have been making progress. Our country is also proud to be close to being certified on verticality and HPV. Increasing taxation and further programs is helping, but it isn't the silver bullet. It's important for us to also have intersectoral discussions so that we can implement financing and sustainability strategies for the healthcare system. Now, we need financial resources in order to overcome the problems such as NCDs. But for many countries which are low-income countries, it is a big ask. So we should focus on prevention. We should focus on multi-sectoral approaches. This is moving in the right direction. And what I can highlight is that African local manufacturing is very important because on this topic, we should see lower income countries in a different light. They should benefit from more support. Thank you very much.
Thank you, Sao Tome and Principe, followed by now Mali, followed by Sierra Leone.
Merci, Madame la Présidente.
Thank you, Madam Chair. On behalf of Mali, I congratulate the Regional Director for the quality of the report that has been presented. Mali welcomes the commitment of the region to maintain its levels of commitment despite the lack of funding. We welcome strategic priorities and the efforts that have been made to get us closer to their achievement. UHC, preparedness for emergencies, sustainable development and investment in healthcare workers, all of these are very important priorities. And Mali has been looking for ways to find better local funding options. We have a One Health system in Mali, and we are increasing our capacity, our response capacity. But we do have to admit that challenges remain, especially when it comes to resource mobilization and training. We therefore need to increase our efforts to overcome these obstacles and ensure that we are able to respond to future emergencies more quickly. Now, when it comes to sustainability, Mali is continuing to find more and more domestic resources. This is in line with the Lusaka agenda and others. We are also aiming to reduce dependence on ODA and external aid. Now, when it comes to development of healthcare workers, we've been investing in early training. The health of our people is the basis upon which socio-economic development is based. And thanks to increased cooperation, and if we have more robust healthcare systems and stronger leadership on a continental level, we can move closer and closer to the goal of UHC and health sovereignty. We take note of the report and we welcome the strategy. Thank you.
Thank you, Mali. Sierra Leone, followed by Gabon.
Thank you, Madam Chair. I deliver the statement on behalf of the Minister of Health of Sierra Leone. I want to commend the Regional Director for a comprehensive, forward-looking report that accurately reflects both the tremendous resilience of our continent and the critical health challenges we must collectively overcome. In line with the Regional Director's strategic vision, Sierra Leone remains committed and steadfast to transforming health care delivery through primary health care as the fundamental engine for universal health coverage. To turn these reports and recommendations into reality, Sierra Leone highlights 3 urgent priorities and more: workforce investments. We must accelerate regional strategies to train, retain, and protect our health workers. We should also invest in local health security and domestic financing, climate change, and resilient health care in Sierra Leone. I'm also recommending that we look at research for health as an evidence-based strategy to improve health outcomes across the region. We must also look at gender equity. As it is now, we've already developed our National Health Sector Strategic Plan, and we've also developed our health financing strategy 2026 to 2030. We just validated our health sector gender policy. And so I want to commend this audience and to state that Sierra Leone delegation, on behalf of the Minister of Health, remains committed to prioritize the strategic initiative noted in this meeting and to state that we'll closely work with colleagues across the region to improve health outcomes. Thank you very much.
Thank you, Sierra Leone. Gabon.
Thank you, Madam Chairperson, Regional Director, honorable ministers and distinguished delegates. We are very enthusiastic about the report presented by the Regional Director on Vision 2035, and we commend the leadership of the WHO. We are very happy about the new era of health for Africa. And for us, it brings to mind pharmaceutical sector. We want to have regional production of commodities. Gabon wants to produce commodities and other health products and has a factory for generic drugs that is located in Cork, which is a special economic zone. The country has a medical agency in line with the AU recommendations. We are committed to the process of getting ML3 of the WHO. We would like to have increased African synergy to have regional factories or manufacturing firms. We want to have accelerated harmonization through ECOS and the AMA, and we recommend the creation of a specific fund for local pharmaceutical companies. That fund will help us tailor the supply to demand and will also improve delivery timelines for our citizens. We have digitized our health system as well as the health map to inform our public health policy. And we also are trying to build our health workforce and ensure that we provide quality services. We would like to thank the WHO for its constant support in all the projects, and particularly the one linked to the reduction of maternal and child mortality. Let us remain united so that Africa's health sovereignty becomes a reality. Thank you.
Gabon, South Africa, followed by Guinea-Bissau.
Chairperson, on behalf of the Minister of Health of South Africa, we warmly congratulate you on your appointment as Chairperson of RC76. We have full confidence in your visionary leadership guiding our deliberations this week. We also commend the Regional Director and the entire Secretariat for a comprehensive report on the work of WHO in our region, capturing both our shared triumphs and our stark realities as we chart our path towards Vision 2035. Excellencies, this year's deliberations take place against the urgent backdrop of the ongoing Ebola virus disease outbreak in our region. We express our deepest solidarity with the affected member states and frontline workers, underscoring that robust cross-border coordination and emergency preparedness are more critical than ever. To truly protect our continent, we must accelerate the work of restructuring the global health architecture. Past inequities in accessing medical countermeasures must be permanently dismantled. At the core of this transformation is the absolute necessity of health sovereignty, ensuring that African nations retain independent control over health security policies, domestic manufacturing capabilities, and our collective destiny. South Africa strongly supports a reformed global health architecture rooted in this sovereignty, equitable benefit sharing, and binding rules that prioritize fairness over goodwill. For South Africa, The report highlights the necessity of domestic resilience and sustainable health financing in the face of shifting external aid landscapes. We are proud to maintain strong domestic ownership of our HIV response while scaling up innovative prevention and cancer screening frameworks. However, we remain acutely aware of persistent regional challenges, including the dual burdens of TB and HIV, rising non-communicable diseases, and the vulnerability of our health systems to external shocks. As we advance progressive health reforms domestically, we remain fully committed to regional solidarity, health sovereignty, and joint security frameworks. South Africa stands ready to work alongside the regional director, the secretariat, and all member states to build a resilient, self-reliant Africa. I thank you.
Thank you, South Africa. Guinea-Bissau.
Muito obrigado.
Thank you very much, Madam Chair. I would like to take the opportunity to congratulate you upon your election as Chair of the 76th session of the WHO for Africa. I would also like to congratulate the Regional Director for this very important document that has been presented. It really does reflect the situation in our respective countries. As for Guinea-Bissau, health priorities include strengthening the healthcare system and moving towards UHC. And our priorities include increasing the quality of primary healthcare, ensuring that communities have better access to healthcare. We also want to reduce neonatal and maternal mortality rates. We want to increase sexual and reproductive health rights. We want to reduce rates of malaria, TB, and other diseases. We want to ensure that preventable diseases are prevented effectively by vaccines. We are also increasing our epidemiological surveillance. We are investing in further education for healthcare workers. We are also ensuring that healthcare workers can benefit from further training. We are increasing investments in health. We are also reducing our dependence on external aid, and we are protecting households from high out-of-pocket costs. We are also pursuing the path of digital transformation. That is yet another essential priority for us. It's also important for us to keep in mind climate change, and in this context, we are pursuing the One Health program. And given that these are our priorities, Guinea-Bissau can support Vision 2035. We think that this vision is an objective that we should indeed continue working towards to improve the situations in our countries. Finally, I would like to thank the WHO for the projects which have been implemented to support the health of our people. Thank you.
Thank you, Guinea-Bissau. Thank you, colleagues. I don't see any other request or the floor from member states. I invite the representatives of other region, member states from the other region, UN agencies and other IGOs to raise your plates now. Russian Federation, followed by Belgium.
Thank you, Madam Chair. Honorable Regional Director, Excellencies, ladies and gentlemen. This is the first time Russia has participated in the Regional Committee for Africa. In this regard, we would like to begin by thanking the member states of the region for making this possible. Let me also thank the government of Ethiopia as well as the regional director and his team for the outstanding organization of this meeting. We share the priorities and challenges of the current session. Russia is addressing them at the national level by building a comprehensive and resilient healthcare system that covers the full spectrum of medical care that is provided to citizens free of charge. With respect for linguistic diversity of the region, I will now proceed in French. Nous sommes disposés à faire profiter nos partenaires africains de cette expérience, non en proposant des solutions toutes faites.
It's very important for us to find solutions which respect the specificities of each country. We are very much convinced that health cooperation at a global level must be based upon the values of sovereignty, mutual respect, and the taking into account of national specificities and priorities. We also support the vital role played by the WHO in all of this, and we hope to only increase our cooperation with the African region. Thank you very much.
Thank you, the Russian Federation. Belgium, followed by Islamic Republic of Iran.
Madam Chair, distinguished colleagues, on behalf of Belgium, I'm honored to participate in this regional committee as an observer. Like all participating member states, we are deeply concerned about the current funding shortfall. External health aid is projected to fall by around 30% at a time when 152 million people in the region already face financial hardship due to health spending. Recent outbreaks remind us what is at stake when surveillance laboratories and health systems, more broadly, are underfunded. Belgium has always been a strong advocate for accessible, high-quality health systems, and therefore strongly supports Vision 2035. In times of shrinking resources, cooperation and clear priorities are more important than ever. This same spirit should guide our work on the pandemic agreement. Belgium stands ready to help build consensus on an ambitious and equitable PABS annex and turn multilateral cooperation into better protection for people. Thank you.
Thank you, Belgium. Islamic Republic of Iran.
Good afternoon, Madam Chair, distinguished delegates, ladies and gentlemen. My name is Dr. Hassan Esfandiar, the Vice President of the International Relations at the Iran University of Medical Sciences. Our discussion today occurs in a world of profound fragility, a truth starkly underscored by recent wars imposed in my country. As you may be aware, the recent imposed war on Iran has inflicted devastating blows on Iran's health infrastructure, with over 300 medical facilities, 25 pharmaceutical companies, and the critical institutions like the POSTO, one of the vaccine production company, institute damaged or destroyed. Tragically, we lost 24 health workers with many more injured. These numbers represent a direct assault on the very foundations of public health and a clear violation of the international humanitarian law. Yet even amidst these devastation, we have witnessed an extraordinary demonstration of the country resilience in the country. Iranian Red Crescent and search and rescue teams and volunteers transported the injured, and local networks, communities maintain essential care when formal systems were stretched to their limits. This resilience in the bedrock upon which we must build reforms global health architecture, one that is more representing and robust.
Thank you.
Thank you so much.
Thank you, Islamic Republic of Iran. Thank you. I see no IGOs or other other UN, other representatives from the other region. So I see no more requests from the floor. So I will now give the floor to Dr. Janabi to respond to some of the comments and questions, but also continue with the presentation on the new era for health in Africa. Dr. Janabi, you have the floor.
Excellencies, one message stands out from this report and listening to you, Excellencies. Africa's achievements were not delivered because funding increased. Actually, it decreased, as shown. Achievements were delivered because your leadership increased. When external financing declined last year abruptly, a member state responded with greater domestic investment, stronger ownership, better integration of programs, fewer silos, and more efficient use of every dollar which was available in your countries. I don't have to repeat the entire figures, but 26 countries moved towards integrated planning. We, WHO, became linear, closer to the countries. 75% of our regional workforce is in the country. I personally visited already 20 of your countries this year alone, and together we focus on results rather than structures. So this demonstrates an important lesson. Aid can support progress, yes, but sustainable progress is ultimately driven by African leadership, your Excellencies, African institutions, and African solutions. So your reliable partner, WHO, was, is, and will continue to be there with you. Now, because of time, Honorable Minister, we have listened the comments, we have taken all of them. Now, if you allow me, let me turn to a new era of health for Africa, which is United Action for Vision 2025 strategy. Now, this strategy is about protecting the hard-won gains which you have listened, while building a more health system equipped for challenges and opportunities of the decade ahead of us. So, Vision 2035 describes the future we want to build together. This strategy provides the pathway to get there, while accompanying the regional strategy plan translates that direction into action for the first 5 years, 2026, 2030. And the message is very clear here. Countries lead, partners align, and WHO adapts. Delivering this strategy will require a shared responsibility. For member states, it means strengthening national ownership of health system and progressively increasing domestic investment in primary health care. For partners, it means aligning investments behind country priorities and supporting the national and regional capacities needed for greater health sovereignty. And for us, WHO, it means adapting the way we work so that we can better support countries to deliver the 7 flagships at a scale. Member states will need implementation. Our partners will be essential to its success, and WHO must be ready to change with them. I will cover the case, the content, the delivery, financing, accountabilities. Now, let me take you briefly through the strategy itself. What does it mean? Why is it needed now? How was it developed? What it proposes and how it will be implemented, because that's very important. I will then turn to the investment required and how we will measure progress and report back to this committee, one distinction is important. The strategy takes us to 2035, while the regional strategic plan provides the operational detail for the first 5 years from 2026 to 2030. So let us begin with the health system we have today and what they will need to deliver over the next 10 years ahead. So programs saved lives, we have seen it, but systems were not strengthened. Programs saved lives, systems were not strengthened. So the systems now have to be strengthened. Africa has made significant health gains over the recent decades, and disease-specific programs have contributed enormously to that progress. But the health system on which lasting progress depends have not always been strengthened at the same pace. That is the challenge we must now address. Africa must close the gap between the health needs and the system capacity. Our region is a home to more than 1.5 billion people with a median age of just 19 years. We carry the highest disease burden of any WHO, of any 6 of the WHO region, while having the lowest per capita health spending. Many of our health systems were designed for a very different demographic, epidemiological, and financing landscape. Yet, the demands on them have grown enormously. Over the past decade, if you look, the gap between what the health system can deliver and what our population needs has widened. So we must close that gap while protecting the gains already made. New pressures have required health systems built for the future, and the pressures on those systems will continue to change. More than 60% of Africa's population is under the age of 25. So our health system must meet their growing needs while harnessing the potential of a young generation. Rapid urbanization is changing where, when, and how people need health services. Climate changes we have seen is altering disease patterns. We saw here in Ethiopia, Marburg for the first time early this year, and it really disrupting essential services. Digital technologies and artificial intelligences are creating a new possibility for how we plan and deliver care. But they also require strong governance, infrastructure, and skills. And as external assistance declines and fiscal pressures rise, domestic resources mobilization and smarter spending are becoming increasingly important. Now, these forces will shape what our health system need to deliver between now and 2035. Sustainable health financing must become more domestic and self-reliant. Of these forces, the financing environment deserves particular attention. Today, only 3 African countries, the member states, have met the Abuja target of allocating 15% of the national budgets to health. So continued underinvestment could cost the continent an estimated 1.4 trillion by 2030. This disruption to malaria financing alone could result in an annual losses equivalent to 1.3% of the GDP, with around 500 million workdays just lost. So as an external health financing comes under increasingly pressure, we need to accelerate the transition towards more sustainable domestic financing. Partners will remain essential to that transition as countries strengthen the systems and capacities needed for greater self-reliance. It was discussed yesterday. The transition is crucial. So the strategy is country-owned and partner-informed. These are some of the realities that have shaped a new era health for Africa. But this is not a strategy developed by WHO alone. It has been built with our member states, grounded in their priorities, experiences, and ambitions, and informed by the partners, experts, and implementers who will help turn its commitments into results. A broad, rigorous process created a shared ownership. All 47 member states contributed through consultancies, ministerial engagements, planning meetings, and a regional stakeholder survey. More than 500 stakeholders were involved, including program directors, national and district managers, technical expertise, and partners. 4 technical working groups, one for each regional, helped guide its development. So successful drafts were reviewed and refined before validation. So this process has helped ensure that the strategy reflects the realities that countries face and our shared ambition for the decade ahead of us. The strategy turns shared directions into actions. That extensive consultation has given us a shared direction. Let me now turn to what the strategy proposes. Healthier lives depend on resilient, modern and self-reliant systems. Our vision is a healthier lives through resilient, modern, and self-reliant health systems across the entire continent. So the mission defines WHO's role in helping member states achieve it. We will shape the region health agenda, convene collective actions, and support integrated people-centered health system through evidence-based norms, standards, and our usual technical support. We will also strengthen our focuses on the implementation and accountability so that our support translates into measurable results. Our role is to enable countries and communities to lead and sustain their own healthy transformation. This strategy also builds on commitments already made, including WHO 14th General Program of Work, the Africa Health Strategy, and Agenda 2063. So the 7 flagship turn ambitions into results. The four regional priorities are translated into action through 7 interconnected flagships. At the center is our integrated community-based primary health care across the life course. 4 flagships strengthen the capacities. It depends on resilience and climate actions, digital transformation, the health workforce and leadership, and institutional performance. The final 2 focus on regional manufacturing and pooled procurement and on sustainable health financing partnership and sovereignty. They are designed to work together and translate ambition into measurable results. Regional solidarity strengthens national systems, and some of these can only be achieved by working together. Not every country can develop every capacity it needs on its own. The regional cooperation gives us a greater collective strength. Pooled procurement, for example, can reduce unit cost of essential medications and vaccine by 30 to 40%. And I can attest, we, WHO, guided small island development states, meaning Mauritius, Madagascar, Cape Verde, Seychelles, Comoros, and Equatorial Guinea earlier this year. And really, I was there to meet the Prime Minister, Narendra. All those countries now, the prescription cost has gone down between 16 to 34%. So regulatory harmonization, if I go back to the speech, that was an example of pool procurement. If I move further, regulatory harmonization can reduce registration timelines by 2 to 3 years, helping countries assess health products more quickly and at a lower cost. So the same principle applies to manufacturing, public health institutions, and the health workforce. So regional capacity can strengthen national systems. So build the foundation, scale what works, sustain the gains. So how do we turn these priorities and flagships into action? So our approach is straightforward: build, scale, and sustain. So one shared direction adapted to each country. Implementation will take place in 3 phases. From 2026 to 2028, we build the foundation: primary healthcare, digital infrastructure, the health workforce, financing, and governance. Now, from 2028 to 2032, countries scale and integrate successful approach across the health system. Now, from 2032 to 2035, the emphasis shifts to sustaining those gains and embedding them within the national system. By then, we want to see stronger domestic financing, greater national capacity, and a health system able to maintain essential services even when faced with shocks. Countries will not, I don't believe, and we don't believe at WHO, that countries will move at the same pace. The direction is shared, but the pathway must reflect each country's context. Stronger systems are both a health and economic investment. So let me now turn to the investment required to make this ambition a reality. The case for stronger health system is both a health imperative and a compelling economic one. So prepared systems cost less than crisis. I've seen it in Ituri. So every $1 invested in the health workforce can generate up to $19 in economic returns. Now compare that with the cost when health systems are not prepared. Good example, COVID-19 cost Africa economies an estimated of $1 trillion in lost output over just 2 years. So the West African Ebola, we all remember outbreak in 2014, 2016, costs those 3 countries which were affected, Liberia, Sierra Leone, and Guinea, an equivalent of the entire annual health budgets. So prevention, preparedness, and strong systems are therefore investments in both health and economic resilience. So invest in national capacity, not parallel system. So delivering the first 5 years of the strategy will require an estimated of 1.625 billion across the 7 flagship from 2026 to 2030. So it is substantial investment, and we must ensure that it builds lasting capacity. Partner financing should support national and regional priorities and strengthen the domestic institution rather than creating a parallel structure. And all of us, member states, partners, WHO must collectively accountable for the results we achieve. The detailed investment envelopes are set out in the regional strategic plan. Most importantly, accountability will keep delivery on track, which brings me to accountability talk. We must be able to show whether this strategy is delivering what we have promised. So scoreboards will show progress and guide actions. Progress will be measured into two levels. At strategic level, we will track a focused set of regional outcomes, including primary healthcare, health security, capacity, and digital health maturity and sovereign financing. At the flagship level, output and progress indicators will show how implementation is progressing. Annual reviews will help us see where progress is being made, where additional support is needed, and where we need to adapt. Regional scoreboards will come back to this committee every year, supported by Regional Data Hub. You'll be able to see what is working, where progress is falling short, and what we are doing about it. At the lead, so what this asks us to do is lead, align, invest, and stay accountable. So what will take to turn this strategy into results? I think for member states, it means sustainably increasing domestic investment in primary healthcare with the Abuja Declaration targets as our shared ambition, and giving primary healthcare and universal health coverage the institutional support they need. It also means making the case of our ministries of finance that health is an investment in our people, our resilience, and our economies. For partners and financiers, we ask that support strengthens the national systems, aligns behind country priorities, and builds lasting domestic capacity. And all of us must embrace mutual accountability for the results we achieve. WHO will equally accountable too for the quality of support we provide and for our changes we have committed to within our own organization. So I think together we can deliver Vision 2035. So Honorable Minister, I do repeat, the annual report showed us what our region can achieve, even under extraordinary pressure. This strategy is about protecting the hard-won gains while building a healthy systems equipped for the challenge and opportunities of the decade ahead of us. That will require sustainable leadership from member states, strong and allied partnership, and WHO that continues to adapt the needs of the countries we serve. If we act together, I do believe we can translate this shared vision into a stronger and a more resilient system, and ultimately a healthier lives of our people. I commend the new era of health for Africa, United Action for the Vision 2035, to the committee with confidence in our shared commitment to deliver it. I thank you. Merci beaucoup. Muito obrigado. Thank you.
Thank you, RD Dr. Janabi. I will now open the floor for member states. Eritrea, followed by Comoros.
Thank you, Madam Chairperson, and we wish to congratulate you and members of the Bureau for your elections. Eritrea commends WHO Regional Office for Africa for developing the vision. The vision comes at a critical time. Africa continues to face multiple and interconnected challenges, including demographic and epidemiological transitions, climate-related risk, recurrent public health emergencies, financial constraints, and a growing burden of non-communicable diseases. These realities require bold and transformative action, as incremental approach will no longer be sufficient. Eritrea welcomes the 4 strategic priorities outlined in Vision 2035. We particularly appreciate the strong emphasis on primary health care, strengthened district health systems, health workforce development, digital transformation, sustainable financing, local manufacturing, and regional solidarity. We support this focus on country ownership, Africa-led solutions, and differentiated implementation that respects national context and priorities. At the national level, Eritrea will continue to prioritize resilient primary health care, access to health services for underserved communities, workforce capacity development, reliable health information systems, and sustainable use of national resources. We support strengthened regional cooperation in technical exchange, workforce development, interoperable information systems, and preparedness for cross-border health threats. In conclusion, Eritrea reaffirms its commitment to regional solidarity, mutual learning, and collective action. We stand ready to work with WHO, member states, and partners to advance an Africa-led health agenda that delivers equitable health outcomes, resilient health systems, and greater health sovereignty for our continent. I thank you.
Thank you, Eritrea. Comoros followed by Ethiopia.
Okay. Merci.
Thank you, Madam Chairperson, Madam Chair, Mr. Director, Regional Director, dear delegates. The Union of Comoros would like to thank the Secretariat for this quality document, and we commend the leadership of the Regional Director when it comes to developing Vision 2035 for a new era of health in Africa. Comoros fully supports this vision, which places at the core of regional action universal medical coverage, resilience of health systems, digital transformation, and strengthening Africa's health sovereignty. These priorities align with those of our country, aiming at strengthening primary health services, improving financial protection for the population, and ensuring equitable access to health and quality health services. We are a small island state, developing island state, and we focus on strengthening health systems when it comes to health emergencies and also when it comes to climate shocks and the disruption of supply chains. We like to focus on the One Health approach, emergency preparedness, and also regional solidarity mechanisms that are going to be put in place. We'd like to commend the initiative aiming at accelerating the digital transformation of health systems, capacity building of health, human resources, and also promoting the local production of medicines and EMLs for island states. These investments are essential to reduce structural vulnerabilities linked to our status of island states. We also wish to improve or make access to health products more sustainable. It is very important to finance health in a sustainable way while focusing on national or domestic resource mobilization. We support the African Fund for Health or Public Health Services that is being revitalized, and it's important to explicitly take into account the specific vulnerabilities of island states when it comes to finances in order to ensure efficacy. And in implementation, I'd like to conclude by saying that Comoros supports the adoption of Vision 2035 and reiterates its commitment to work with WHO, member states, and partners in order to build an Africa that is healthier, more resilient, with more solidarity, sovereignty when it comes to our health. Thank you.
Thank you. Ethiopia, followed by Gambia.
Thank you, Chair. Ethiopia supports and welcomes a new era of health for Africa, United Action for Vision 2035. The four strategic priorities are the right one, and the flagship match where Ethiopia is already investing. The huge Green Legacy Initiative, which is being led with His Excellency Prime Minister Dr. Abiy, under the Resilience, a National Health Intelligence Center under the Digital Transformation, a maturity level 3 regulatory authority, and the local production exceeds 40% of our medicine under regional manufacturing. We congratulate the regional director on clear 10-year direction shaped by us all members of states. In this regard, we make three requests: measurement, coherence, and finance for the realization of the vision. Ethiopia commands the RD for the engaging processes in preparing this document, its linkage and alignment with GP40, and committed to align national planning and contribute to the flagship of Vision 2035. I thank you.
Thank you. Thank you, Ethiopia. Gambia, followed by Senegal.
Thank you very much, Madam Chair. We congratulate you and your deputies for your election. The Gambia commends Dr. Mohamed Yakub Janabi, the Regional Director, and the WHO Afro team for developing a new era of health for Africa, United Action for Vision 2035. The Gambia fully supports this bold transformative vision, which recognizes health as a strategic driver of sustainable development, resilience, equity, and regional sovereignty. We welcome the consultative and country-driven approach used in preparing this framework and appreciate its alignment with Agenda 2063, the Sustainable Development Goals and the aspirations of African member states for stronger, more resilient, and self-reliant health systems. The Gambia agrees that Africa is at a pivotal moment. Rapid population growth, urbanization, climate change, recurrent disease outbreaks, and the rising burden of non-communicable diseases are placing unprecedented pressure on our health systems. At the same time, constrained fiscal space and uncertainty in external financing require new approaches to health investment, service delivery, and partnerships. The Gambia has made progress by strengthening primary health care, expanding access to essential health services, maintaining high immunization coverage, improving maternal and child health programs, and enhancing disease surveillance and outbreak response capacities. Additional investment in laboratory services, emergency preparedness, community health systems, health workforce development, and digital health have enhanced resilience and data-driven decision-making. Despite these achievements, significant challenges remain, including health workforce shortages, limited fiscal space, increasing demand for services, climate-related health risk, the growing burden of non-communicable diseases, dependence on imported medicines and health technologies, and gaps in digital infrastructure. Addressing these priorities will require stronger domestic resource mobilization, increased investment in human capital, expanded digital health infrastructure, and enhanced regional cooperation. We therefore call upon WHO, development partners, and regional institutions to continue supporting member states in implementing the flagship initiatives and strengthening country ownership of health sector reforms. The Gambia fully endorses a new era of health for Africa, United Action for Vision 2035, and supports the adoption of the related resolution. Thank you very much.
Thank you, Gambia. Senegal, followed by Mozambique.
Merci beaucoup, Madame. Thank you very much, Madam Chair. Madam Chair, Ministers.
Excelência Ministro de Moçambique. Moçambique saúda a apresentação do relatório e felicita o Dr. Janab, diretor regional inclusivo. Pelo processo.
We'd like to thank the Director for this report. We support the proposal, considering it a strategic instrument to help us achieve universal health coverage. We believe that the new strategy takes into account health challenges, climate challenges, and helps us reduce our external dependence on essential health products. With a view to operationalizing the strategy, allow us to please contribute with a few ideas. We believe it is important to create an implementation framework that goes hand in hand with a regional operational plan with short-term and medium-term targets, regulated mechanisms that will allow us to ensure accountability by member states. Secondly, we also propose that technical cooperation mechanisms between countries be reinforced so that we can share knowledge, create networks among countries, and also allow for epidemiological vigilance, hospital management, cooperation between laboratories, help manage medication, and also strengthen our PHC. Finally, we reiterate that we are committed as a country to working towards promoting this new era of health proposed here today. Thank you very much for your attention.
Senegal, followed by Namibia. Excuse me.
Madam Chair, Ministers, Director General of WHO, distinguished delegates, Senegal would like to applaud the Regional Director of the Regional Office for the United Action for Vision 2035 and for his report. We welcome this inclusive approach and the inclusion of countries in this process. It is important that we consider epidemiological processes, climate change, and the major transformation required in the African health system. The strategic plan is an opportunity for Senegal, which has just concluded its national strategy for 2025-2034. The main priorities are taken into account in the plan, including UHC. We believe that it is important to open the health sectors to other sectors so that we have health across all policies. We need to protect against financial risk connected to ill health. We welcome the creation of compulsory insurance mechanisms. We would also make an appeal that there be solidarity, African solidarity in developing a local pharmaceutical industry. We need also to make sure that regional coordination mechanisms are fully operational. We must mobilize domestic resources with a view to reducing the need for us to have medical evacs. We support the report and commit to working with all stakeholders so as to successfully implement this new strategic vision with a view to promoting progress in our continent so as to achieve UHC. Thank you very much for your attention.
Thank you. Senegal, Namibia, followed by Zambia.
Thank you, Chair. Namibia welcomes the report under this agenda item. The Regional Director's vision for a resilient, self-reliant Africa deeply resonates with Namibia's national health aspirations. In alignment with flagships 1 and 3 of this particular strategy, Namibia is actively digitizing our health information systems and elevating our commitment to primary health care as a base to universal health coverage. To this end, Namibia has moved beyond a universal health coverage policy by drafting a comprehensive universal health coverage bill that regulates the delivery of an essential package of health services at all health facilities, while establishing innovative micro-contributions to strengthen domestic health financing. However, we also recognize that true health security relies heavily on domestic capacity. Therefore, Namibia is particularly supportive of this document's strong alignment with the African Union Agenda 2063, as well as the strategic objectives of the Africa CDC. The emphasis on health sovereignty, local manufacturing, as well as regional pooled procurement directly supports the continent's agenda for self-determination in health. As donor support undergoes shifts and contractions, it is imperative that we optimize our resources. We do encourage the Secretariat to work collaboratively and synergistically with the AU and Africa CDC. It is essential to avoid duplication of efforts and ensure that our continental institutions act as unified forces, multiplying our collective impact. In closing, Namibia urges member states to accelerate investments in health workforce and to commit to building a robust regional manufacturing ecosystem. Concurrently, we call upon the Secretariat and our partners to ensure all operational plans align with country priorities, maximizing efficiency and cementing Africa's health sovereignty. Namibia endorses the Vision 2035 framework. I thank you.
Thank you, Namibia. Zambia, followed by Burkina Faso.
Honorable Chairperson, Zambia commends the Regional Director, Dr. Yakub Janabi, and the WHO Afro team on the development of this regional strategy and strongly welcomes a new era of health for Africa, United Action for Vision 2035. We commend the emphasis on country ownership, African-led solutions, resilient health systems, and health sovereignty. This vision comes at an important time when our health systems face growing pressures from outbreaks, climate change, non-communicable diseases, workforce constraints, and limited health financing. We particularly welcome the focus on universal health coverage and strengthening primary health care. Resilient health system must start at the community and district levels, supported by commodity security, integrated services, strong community engagement, and financial protection. We also support greater emphasis on domestic health financing, local manufacturing, technology transfer, and pooled procurement. Africa cannot achieve health sovereignty if we remain heavily dependent on external financing and imported health products. Digitally enabled and motivated health workforce will also be essential. Strong data system, effective leadership, and evidence-based decision-making will assure better health outcomes. Zambia therefore calls for Vision 2035 to remain country-driven at the outset, adequately resourced with a means to measure results. Zambia stands ready to work with member states, WHO, and partners to turn this vision into action and build a healthier, more resilient, equitable, and self-reliant Africa. I thank you.
Thank you, Zambia. Burkina Faso.
Thank you very much, Madam Chair. Madam Chair, Regional Director, dear delegates, Burkina Faso welcomes the initiative, A New Era of Health for Africa, United Action for Vision 2035, and congratulates the Regional Director on this ambitious vision based on UHC, resilience, modernization, and also health ownership and sovereignty. We welcome its alignment with existing frameworks and the emphasis placed on solutions designed and led by Africa, supported by strong national leadership, increased domestic investment, and long-lasting partnerships. Madam Chair, Burkina Faso fully endorses the 4 priorities of Vision 2035 and the flagship initiatives that put them into practice. Our country also attaches particular importance to the digital transformation of healthcare. In this regard, in addition to the strategic plan for digital health and a national digital health architecture, it has adopted a roadmap on AI to strengthen interoperability and also establish a health intelligence center, making sure that all levels of healthcare and services are included. We also welcome the emphasis placed on regional manufacturing, joint procurement, and the increased mobilization of national resources, which are fundamental drivers of health sovereignty. We encourage the WHO to support member states in integrating these priorities into their national policies and plans. Finally, our delegation takes note of the report and endorses the initiative as a strategic framework for advancing health development, resilience, modernization, and also health sovereignty in the WHO African region. Thank you very much.
I don't see any other requests for the floor from member states. I invite representatives of member states from other regions, UN agencies, and other IGOs to raise their nameplates. UNICEF, you have the floor, followed by IOM.
Honorable Chair, Regional Director, Excellencies. UNICEF thanks the Regional Director for the report and commends WHO's leadership in advancing Africa's health agenda. We welcome the focus on resilient primary health care and community-based primary health care, sustainable financing, governance and accountability, health workforce strengthening, emergency preparedness, and local production of medicines and vaccines on the continent as key drivers of better outcomes for women, children, and adolescents. As Africa advances towards Vision 2035, UNICEF calls for accelerated implementation of the Lusaka Agenda and a more coordinated, country-led health architecture that delivers measurable results for every child. We also welcome ongoing discussions on global health architecture reform and emphasize the importance of a more coordinated, efficient, and country-centered health ecosystem that supports integrated service delivery and sustainable system strengthening.
Thank you,
UNICEF remains committed to working with WHO, member states, Africa CDC, and partners to advance SDG 3
UNICEF.
and strengthen health systems across the continent. Thank you.
Thank you, UNICEF. IOM, followed by the AU Africa Business Council.
Honorable Chairperson, distinguished guests, delegates, all protocols observed. On behalf of the International Organization for Migration, IOM, I wish to commend the strong leadership of member states and WHO in advancing health security and sovereignty across the African region. Through both periods of calm and times of outbreak, this leadership has been instrumental in strengthening preparedness, response, coordination, and resilience. IOM is proud to stand alongside governments, WHO, and other actors as a trusted partner, supporting efforts to prevent, detect, and respond to ongoing public health threats, particularly in the context of population mobility, migration, and cross-border health risks. Our work is guided by the Health Border and Mobility Management Framework, which aims to make migration safe and orderly within the regularity that it happens in. As Africa continues to grow and become increasingly interconnected, IOM remains very committed in working closely with member states, WHO, and partners to strengthen cross-border collaboration, build a healthier, safer, and more resilient future for all, including migrants and mobile population. I thank you.
Thank you, IOM. The AU African Business Council.
Thank you, Chair. Congratulations, chairs and the deputies, and congratulations, Professor Mohammed Janabi, for a presentation of a new era of health for Africa United Action for Vision 2035. I think the Vision 2035 presents an important opportunity to place health at the center of Africa's development agenda. Achieving this vision, however, will require more than the efforts of governments and development institutions alone. The Africa private sector must be recognized and engaged as a strategic partner, bringing investment, innovation, technology, manufacturing, capacity, entrepreneurship, and sustainable solutions to Africa's health priorities. The Africa Business Council, as a continental platform and advocacy voice for African private sector, stands ready to work with WHO, African Union member states, financial institutions, and other partners to mobilize and strengthen private sector participation in Vision 2035. And our mandate includes promoting investment industrialization, strengthening public-private dialogue, and partnership facilitating business linkages. So we are ready as Africa private sector to stand to realize the United Action for Vision 2035. Thank you.
Thank you, AU African Business Council. Now we will move to non-state actors. United to Combat NTD, followed by International Federation of Pharmaceutical Manufacturers. Each 1 minute, please.
Chair, Excellencies, Uniting to Combat Neglected Tropical Diseases warmly welcomes a new era for health for Africa, United Action for Vision 2035. We particularly welcome its vision of country leadership, resilient health systems, and health as a driver of sustainable development and prosperity. Realizing that vision will depend not only on the strength of our health systems, but also on recognizing health as an investment in Africa's future human capital. Building on the WHO roadmap, the recent UN Human Rights Council resolution on human rights and neglected tropical diseases, championed by African member states, demonstrates that Africa's growing leadership is shaping the global health agenda. By strengthening political leadership, multi-sectoral action, and national ownership, it provides an important platform for advancing the ambitions of Vision 2035. As Africa looks towards 2035, eliminating neglected tropical diseases should increasingly be recognized not only as a health objective, but as an investment in education, productivity, resilience, and shared prosperity. We encourage member states to use both the WHO NTD roadmap and the momentum created by the Human Rights Council resolution to embed NTD elimination within broader national development strategies. Uniting looks forward to continuing to support member states, WHO, Afro, and partners in realizing that shared ambition.
Thank you. Thank you, United to Combat NTD, International Federation of Pharmaceutical Manufacturers and Association, followed by Drug for NTD Initiative.
Thank you, Chair. The International Federation of Pharmaceutical Manufacturers and Association welcomes the Vision 2035 strategy, including its emphasis on accelerating UHC, health system resilience, digital transformation, health workforce and leadership transformation, and institutional modernization. Geographical diversification of manufacturing can improve access and be sustainable only when there is reliable long-term demand, adequate production and delivery infrastructure, and coherent policy frameworks. These include strong regulation, intellectual property protection, open trade, legal certainty, skilled workforce, and resilient supply chains. With respect to technology transfer collaborations, these should always be on voluntary and mutually agreed terms. Pool procurement should be targeted to settings with limited local procurement capacity and clear unmet needs. It must remain voluntary and non-discriminatory, preserve multi-supplier competition, recognize value beyond price, refrain from winner-takes-all models, and protect physician choice, patient safety, and continuity of care. IFPMA stands ready to work with WHO, member states, and partners to support implementation of this important strategy and its flagship initiatives within effective framework conditions. I thank you, Chair.
Thank you. Drugs for NTD Initiative, followed by HelpAge International.
Ok. Donc, je disais que
I would say that we are very pleased with Vision 2035 and the importance given to health sovereignty. The 7 flagships do cover manufacturing, supply, but they do not mention research and development explicitly as being a foundational element for sovereignty. A company that produces products that require elements that come from abroad does not guarantee full sovereignty. We have to develop new products such as we have for leishmaniasis. We've seen this in Ethiopia, Sudan, Uganda. In February, European regulatory authorities allowed for new medication for HAT. And we see that this is fundamental for CAR and Guinea, as it is a one-dose medication. We invite member states, therefore, to explicitly refer to research and investment in F6 and 7 and to integrate this into the framework of results. Thank you.
Thank you. HelpAge International, followed by International Pharmaceutical Students Federation.
Madam Chair, distinguished delegates, I speak on behalf of HelpAge International and our global network in Africa. As Africa defines its health vision 2035, we have an opportunity to build health system for a population Africa will have, not only the population we have today. Africa remains the world's youngest continent, but it's experiencing a rapid demographic change. The number of people aged 60 and over are projected to be more than triple from around 75 million to 220 million by 2050. Longer lives are development success, yet rising NTD, multimorbidity, and disability brings changing and increasingly complex health and care needs. While many systems remain underprepared and to provide integrated and continuous care across the life course. Vision 2035 is an opportunity to anticipate this transition rather than to respond to it later. This means strengthening universal health coverage, primary and community health system, delivering integrated, person-centered care across the full continuum. Approaches such as WHO's Integrated Care for Older People, ICOP, provide practical pathway for connecting health and social care, supporting functional ability, independence, and aging with dignity in communities. This requires sustainable financing and financial protection, investment in health and care workforce, care economy, access to essential medicine, assistive technologies, inclusive data, and meaningful participation of older people. Healthy aging benefits every generation. By preparing now, Africa can build resilient health and care system that enables people not simply to live longer, but to live healthier lives with dignity, participation, and access to care and support they need at every age. Thank you.
Merci. And distinguished delegates, the International Pharmaceutical Students Federation represents over 600,000 pharmacy students and recent graduates across more than 100 countries. Through webinars, training programs, regional symposia, and our annual World Congress, most recently in Thailand, under the theme Building a Connected Future, celebrating diversity and fostering initiatives for the next era of pharmacy, IPSF actively invests in the next generation of pharmacists. As highlighted in the draft resolution on Vision 2035, member states are encouraged to build equitable health systems around universal health coverage, resilience, modernization, and sovereignty, delivered through digital transformation, workforce leadership, regional manufacturing, and sustainable financing. IPSF recognizes the Vision 2035 cannot succeed without sustained investment in young pharmacists. IPSF therefore calls on WHO and member states to invest in young pharmacists as part of workforce and leadership transformations, involve youth in regional manufacturing and procurement planning, and integrate artificial intelligence education into pharmacy education curricula. Thank you. Merci.
Thank you. I see no more requests for the floor. I'd like to give the floor to Dr. Janabi, who is going to respond to the comments, answer the questions from the delegates.
Excellencies, let me thank you that we have listened to the comments, to the suggestions and questions. Now, with your permission, Vice Chair, if I can pass the mic to our Director of Program Management, Dr. Diallo. Thank you.
Thank you, RD. Thank you, Chair. The Secretariat extends its appreciations to Member States for their statements and endorsement of the Regional Director's report presented earlier and the Regional Strategy, New Era of Health for Africa. The Secretariat takes note of all recommendations made, including implementing baseline indicators and progress report as suggested by Kenya for the report, to work closely with ministries of health to align efficiency, prioritization, and integration reforms as recommended by the Central African Republic. The Secretariat reassures the Comoros of its recognition of seed specificities, as we've done with the pool procurement initiative covered by the Regional Director during his presentation. We would like to emphasize that the larger version of the strategy document includes an implementation framework, enablers such as monitoring and evaluation, resource mobilization, and communication. The Secretariat also takes note of the various innovative initiatives, aspirations, and progress achieved by the Member States and will continue to work with Member States to enhance experience sharing across the region. Finally, the Secretariat reiterates its commitment to support Member States in implementing their identified priorities in expanding universal health coverage, strengthening health security, advancing the modernization and sovereignty agenda. Thank you for your strong and continued partnership.
Merci beaucoup.
Thank you very much. These report on WHO's activities in the African region. The presentation of the report is now concluded. Given the suggestions and comments, can we consider that the committee is ready to take note of the report contained in the document 70, both documents, sorry, RC 76/11 and RC 76/13?
Je ne vois pas d'objection. Nous prenons note.
There are no objections. We take note of the report.
Le comité régional est-il disposé à adopter?
Is the regional committee ready to adopt document 76/11 ADD1 as a strategic framework to promote health development, resilience, and modernization of health, as well as health sovereignty in the African region of WHO?
Je ne vois pas d'objection. Le cas de...
No reactions, so the strategic framework is adopted.
Nous voici parvenus à la fin.
We've reached the end of our deliberations concerning this agenda item. Distinguished delegates, we shall now proceed to the consideration of agenda item 4, report of the Committee on Credentials. I give the floor to the chairperson of the Committee on Credentials, Dr. Babacar Gueye, Ministry of Health, Senegal. Sir, you have the floor.
Je vous remercie, Monsieur le Président.
En ma qualité
Thank you, Chairperson. In my capacity as a member of the delegation of Senegal and elected chair of the Committee on Credentials, I am honored to report to the Regional Committee on the deliberations of the Committee on Credentials. The Regional Committee appointed representatives of the following 7 member states who will serve as members of the Committee on Credentials: Eswatini, Gabon, Sao Tome and Principe, Senegal, Sierra Leone, Togo, and the United Republic of Tanzania.
La commission de vérification des pouvoirs s'est réunie.
The Committee on Credentials met today, August 25th, 2026, and elected me, Dr. Babacar Gaye, Director of Planning, Research and Statistics, Ministry of Health and Public Hygiene, and member of the Senegalese delegation, as chair of the committee. The 7 member states appointed by the Regional Committee participated in the meeting of said committee. The Secretariat reported on the credentials received to date from member states participating in the 76th session of the Regional Committee. The Committee on Credentials enjoined its chair to report to the Regional Committee on its behalf on the credentials transmitted to the Secretariat as of the date of the meeting of the committee. Thus, as at the date of the meeting of the Committee on Credentials, 47 out of 47 member states had submitted their credentials that were considered to be in compliance with the rules of procedure of the Regional Committee. The Committee on Credentials has thus completed its deliberations, and I would like to express my sincere appreciation to the other members of the committee for their support in our work, and to the Regional Committee for considering our report. Thank you, Mr. Chair.
Merci.
Thank you, Dr. Babacar Gaye, for this report by the Committee on Credentials. Are there any comments related to this report of the Committee on Credentials? If there are no comments, I'd like to suggest that the Regional Committee adopt the report and accept the credentials as presented by member states, as mentioned in the report presented earlier. Are there any comments? I see none. The report is therefore adopted. Distinguished delegates, let's now move to agenda item number 7, joint process of the Global Health Architecture Reform. It may be recalled that at the 79th
Membres sont convenus d'instaurer un processus.
At the 79th World Health Assembly in May 2026, member states agreed to establish a joint member state-led process on global health architecture reform hosted by WHO. The process aims to advance a more coherent, equitable, efficient, and country-led global health architecture, including through a member state-led task force that will develop recommendations for consideration by the 80th World Health Assembly in 2027. I'd like to invite Dr. Razia Pense, Chief of Staff of the Director General, to present this agenda item.
Excellencies, delegates, colleagues, partners, NSAs, all protocols observed. It's late in the day and all of us want to move. Let's try and be as concise and efficient as we can. I'll just give you briefly where we are in the global health architecture discussions. It has been mentioned multiple times, I've heard during the day today as well as yesterday. One would ask, why does the global health architecture need reform? What has it delivered? We heard yesterday that the global health architecture has indeed delivered in the last 25 years. Life expectancy has increased by 10 years. We have reduced under 5 mortality by more than half. Maternal mortality is 40% less. 14 million lives have been saved to vaccination, and 40 million deaths have been averted due to HIV, TB, and malaria. So indeed, the global health architecture has delivered. The question is it fit for the challenges of today and tomorrow? As most of you have alluded through your interventions, the global health landscape has changed profoundly and continues to change. The ecosystem has expanded with many actors, partnerships, and financing mechanisms. While each brings value, the result is often fragmentation, duplication, verticalization, and high transaction costs for countries. At the same time, we are faced with demographic and epidemiological transitions that are reshaping health needs and need a health systems and service delivery redesign. People are living longer, populations are aging, non-communicable diseases, cancers, and mental health conditions are increasing rapidly, while we continue to face the challenges of communicable diseases as well as maternal and child health, disease, and disability. These pressures are compounded by a wider polycrisis, geopolitical tensions, shrinking multilateralism, conflict and displacement, climate change, and continued epidemic threats. The abrupt decline in international aid and shrinking ODA over the past year has been a wake-up call. But every crisis creates an opportunity. Africa is leading the way and already helping shape this opportunity through multiple initiatives such as the Lusaka Agenda, the Accra Reset, and the Africa High-Level Ministerial Committee. Together, these point towards a future grounded in health sovereignty, national ownership, and sustainable financing for health, moving away from aid dependency to self-reliance. Recognizing this need, the WHO member states at the 79th World Health Assembly in May 2026 agreed to a WHO-convened, member state-led joint process on global health architecture reform with the 3 objectives. First, to review functions, mandates, and capacities across the global health actors to improve alignment and address gaps. Second, to strengthen coordination, collaboration, decision-making, and accountability to deliver results at country level. Third, to promote sustainable financing aligned with national priorities towards self-reliance. The process is already underway. All 6 WHO regions have nominated task force members, and member states have identified 2 co-chairs, Mr. Bjorn Kummel of Germany and Dr. Yongfeng of China, reflecting the commitment to a balanced leadership from global north and south. The 12 member state representatives to the task force come from Burundi and Ethiopia in Africa, Brazil and Mexico from the region of the Americas, Kuwait and Pakistan from the Eastern Mediterranean region, France and UK from the European region, Bhutan and Thailand from the Southeast Asia region, Japan and Malaysia from the Western Pacific region. The task force has 5 global health initiatives: STEPI, Gavi, the Global Fund, Pandemic Fund, and UNITAID representatives, representatives from 4 United Nations agencies, UNICEF, UNFPA, World Bank, and WHO. The task force members yesterday elected 1 seat of the Regional Health Organization, and that is Africa CDC. The WHO decision is clear. This must be a time-bound process led by member states, convened by WHO, and built on existing efforts. The recently concluded or ongoing global health architecture reform initiatives, be it the Lusaka Agenda, Accra Reset, the Welcome Process, Gavi Leap, CSO Here, the HISP report for EU like-minded donors, or MOPAN, all are converging on the following key messages. The global health architecture needs to be country-led with governance. It has to be country-led with health governance and sovereignty, reduce fragmentation and transaction costs, stronger regional institutions and local capacitation, primary healthcare-led resilient health systems, sustainable financing aligned with national priorities. I've been listening to discussions during this regional committee, and these messages have been reinforced, and country-led solutions have been highlighted that will further inform the ongoing discussions on global health architecture reform. Countries in Africa have called for health to be treated as an investment rather than a cost and central to national development agenda. Increased domestic financing, including innovative finances, leveraging private capital, financial safety nets through social health insurance and similar, to tackle health indebtedness and impoverishment, for external resources to be catalytic and aligned with national priorities and not just replacement financing, for stronger local capacity and manufacturing, data-driven planning, for investment-grade proposition, and for deeper regional cooperation and solidarity, to name a few. Perhaps the most powerful message that I carried from all the conversation is that efficiency is the currency that buys fiscal space. The future global health architecture must be country-led, regionally enabled, and globally aligned. Thus spoke the Accra Reset, and it is so true. And as the Director General Tedros reminded us in the morning, by sharing experience, strengthening solidarity, and working together, we can build a healthier, safer, and fairer Africa while contributing to a stronger global health architecture for all. This is also aligned with the Vision 2035 that we have just discussed. The two guiding questions agreed by the GHA Task Force members for soliciting feedback and input from Your Excellencies from the regional committees are projected on screen. Thank you, and look forward to your further guidance and steer. Over to you, Chair.
Merci, Dr.
Thank you, Dr. Razia. I now open the floor to member states of the African region for interventions.
Comores, vous avez la parole. Vous avez suivi.
Comoros has the floor, followed by Burundi. Thank you very much. Mr. Chair, the Union of Comoros considered this reform of the global health architecture to be a historic opportunity to build a more effective and reactive health system when it comes to the current and future health challenges, more equitable as well. This reform should first and foremost be focused on the needs of countries, as mentioned, and based on national ownership principles. The global mechanisms should support national capacity rather than creating new parallel structures. As a small island country, developing island country, the Union of Comoros would like to emphasize that the specific vulnerability of island states should be fully integrated in the new global health architecture. Our countries are faced with specific constraints related to our status. There's the high cost of health infrastructure, limited human resources, or high cost of logistics, sorry. Limited human resources is another challenge. Apologies. And there's also the impact of climate change. All of this worsens the impact. We also would like the international assistance to be aligned with local needs in order to avoid fragmentation of assistance, to allow us to strengthen the health systems in a sustainable manner. We would also like to emphasize the central role of WHO as the coordinator of global health. So we'd like to see more complementarity between the global, regional, national levels. We'd like to see more cooperation with African institutions so there could be more cohesion in the response. When it comes to health emergencies, the success will be measured based on the impact on the ground in the country's better preparedness for health emergencies, more equitable access to medicines, vaccinations, health technology, predictable, sustainable financing, and human resources capacity building, strengthening of health systems are paramount. Mr. Chairperson, we'd like to see a global health architecture that is more inclusive, with more solidarity, and that focuses more on the peculiarities of small island countries and vulnerable countries. That is the only way that current reforms will meet our shared objective, which is health for all. Thank you. Thank you. Comoros, Burundi has the floor. Thank you, Mr. Chairperson. Burundi would like to commend the progress presented when it comes to the joint process of the global health architecture reforms launched after the Geneva discussions. This reform represents a major opportunity for Africa. We'll be able to build a global health architecture that is more equitable, inclusive, and more aligned with Africa's priorities. Burundi would particularly like to commend the establishment of the joint task force to work on this reform, and with the Federal Democratic Republic of Ethiopia, we are very honored to represent Africa. We would like to thank the African group for this token of trust, and we will play our role in a spirit of solidarity, consultation, and complementarity in order to contribute to bringing out a joint African position that will be cohesive and ambitious. Our conviction is clear. Africa must be more vocal, present in decision-making spaces. Wherever priorities are defined, wherever resources are allocated, we must be present. We also have to ensure that this reform beefs up the role of our continental institutions and allow for more predictable, sustainable financing when it comes to the response and prevention of pandemics. We are available to work with all of the member states so that this reform will be a true opportunity to strengthen the voice, the leadership, and the priorities of Africa in global health governance. Thank you. Thank you very much, Burundi. Tanzania has the floor.
Thank you, Honorable Chairperson. Let me begin by congratulating African CDC and all members of the Global Health Architecture Joint Task Force on their nomination to lead this important process. Tanzania assures you of all full support and constructive engagement. The timing is particularly important. We are operating in a world experiencing geopolitical shift and severe pressure on global health financing. Recent health emergencies, including the Ebola outbreak in our region, remind us that these are real challenges affecting lives. health system and our ability to respond quickly and effectively. What should be the future global health architecture deliver for Africa? Africa must speak with one voice and must stronger representation in the global decision-making with meaningful roles for our regional institutions. We need a clear division of responsibilities between global, region, and national institutions. We must reduce fragmentation and duplication while ensuring financing response to country priorities. Also, we must learn from the past. Africa and the global community have produced many declarations, frameworks, and commitments. It is now time to ensure that these commitments are implemented. Chairperson, for Tanzania, the success of global health architecture reform will be measured by action, accountability, and impact, particularly whether it strengthens country ownership, improves access to financing and technology, and works for all member states, including developing countries. Let us ensure that this reform goes beyond redesigning the architecture on the paper and builds a global health system that is more equitable, responsive, accountable, and fit for the challenge of tomorrow. I thank you.
Merci, la Tanzanie.
Thank you, Tanzania. Zambia, you have the floor.
Thank you, Honorable Chairperson. Zambia welcomes the joint member state-led and WHO-hosted process to reform the global health architecture. We see this as an opportunity to build a more coherent, equitable, accountable, and responsive global health system. While the current architecture has delivered significant gains, fragmentation, duplication, and financing that is not always aligned with country priorities remains challenges. The changing development financing landscape makes reform even more urgent. For Zambia, country ownership must remain at the center. External assistance should complement national leadership and domestic financing. Global health support should therefore align with one national plan and one national budget, while strengthening sustainable domestic financing. We also call for a stronger voice for Africa and other regions, building on the Lusaka Agenda, Accra Reset, and the growing role of institutions such as Africa CDC and the African Medicines Agency. Zambia further supports a strong WHO at the center of global health governance, particularly its normative, standard setting, and convening at technical functions, while ensuring that decisions respond to country and community needs. We welcome inclusive, transparent, and time-bound processes with member states retaining decision-making authority as well as meaningful representation for developing countries. Zambia stands ready to contribute constructively to building a global health architecture that is country-led, equitable, adequately financed, and fit for the future. I thank you.
Thank you very much, Zambia. Senegal, you have the floor.
Je vous remercie, Monsieur le Président.
Thank you very much, Chair. The GHA reform goes beyond administrative governance. It's a sovereignty imperative. We urge you to have a system that makes us more than an intervention zone, but also a hub of production and research. We can only be resilient if we have equitable access to health technology, if we have autonomy in vaccine production as well. We support the taking on board of national priorities in this reform, and we also need to strengthen collaboration and reduce duplication. When we look at epidemics and pandemics, we know that unity is our greatest strength, not fragmentation. We need to turn our demography into a strength in our negotiation environments. We need to strengthen primary health care, community-based care, and make sure that resilience is part and parcel of our health system. Pooled procurement is important to acquire medical products, but we also need to ensure capacity building of the health workforce. We need more predictable efforts focused on national infrastructure rather than ephemeral vertical interventions. We are committed to this process to promote resilience in the African health system. Thank you.
Merci, chers collègues. Je ne vois plus de demandes de parole de la part des États membres de la.
Thank you very much, Senegal. Guinea has asked for the floor.
Merci pour.
Thank you very much for giving me the floor, Chairperson, distinguished delegates. We welcome the GHA reform proposal. Recent crises have shown the limits of our systems. We know that we have a very high level of morbidity in Africa due to this, and that is often to do also with the fact that we have financing that is not always predictable, and we do not always take part in the decision making. We need to take part in the decision making spaces when it comes to making decisions on medical products, allocation and financing. More flexible, better aligned systems focusing on national priorities is fundamental. Mobilizing domestic resources is also fundamental, but that does not mean that partners should completely disengage, transferring financial risk to the most vulnerable states. Thirdly, sustainable investment in regional and national capacity, the health workforce, primary healthcare, surveillance, laboratories, supply chains, local vaccine production, production of medicines, diagnostic products. We need to make sure there is no fragmentation of initiatives focusing on the importance of national systems. We shouldn't be thinking about the number of new structures being created, but rather focusing on outcomes, better decisions, accessible financing, and sustainable ability to allow countries to participate fully in the design and governance of new decisions. Thank you.
Merci. La parole est à Madagascar.
Thank you. Madagascar. Vice Chair, Regional Director, Excellencies, ladies and gentlemen, ministers, distinguished delegates, Madagascar welcomes the joint process undertaken after WHA 79 with a view to strengthening the global health architecture. We also want to see a more coherent, more efficient, more equitable architecture, one that is better aligned with national priorities. For Madagascar, the main challenge faced by our region is the fragmentation of health action and the lack of predictability and alignment of financing in a context where there are few resources, constant health crises, the impacts of climate change, and difficulty in accessing health technology, vaccines, medicines. We should, therefore, go from multiplying initiatives to an approach based on complementarity, based on subsidiarity, and on collective accountability. At a regional level, we believe that it is fundamental that we have an emphasis on collective African action, collaboration in priority definition, epidemiological surveillance, preparation and response to cross-border threats, resilience in the face of climate change, pooling of resources and capacities, namely when it comes to the acquisition of products, supply chains, and regulation of medical products. We need to have a sharing of technical knowledges, strengthening of national capacity, and also of continental mechanisms. we need to focus on global public goods, focusing on knowledge sharing, global surveillance of health threats, coordination of response to pandemics, collaboration in research and development. Financing is fundamental to this reform. Madagascar asks for more predictable, better coordinated financing that is aligned with national health plans without losing sight of the need to strengthen national domestic financing capacity and autonomy. We need an architecture where the national level is well defined, has clear priorities. The regional level has to coordinate, strengthen capacity, and the global level has to determine the rules, produce public goods, and ensure international solidarity. The success of this reform has to be measured not by the number of mechanisms created, but by their ability to do away with fragmentation, strengthen health systems, and produce concrete results for our populations, in particular those that are most vulnerable. Madagascar restates its commitment to a global health architecture that is country-centered, based on equity, solidarity, and complementarity amongst the different action levels and sustainability. Thank you.
Vous avez la parole.
Thank you. Gabon, you have the floor. Thank you very much, Chair, Regional Director. The world is going through a great flux where threats know no borders. We therefore strongly commit to this joint process of global health reform. This crucial initiative shouldn't just be simple administrative reorganization, it needs to be ethical and focus on the structure of international health governance. For Gabon, this global reform needs to focus on three main pillars: total equity and access to resources. The recent crises have shown the difficulties faced by our systems, our current systems. We need to have access to medical countermeasures, to emergency financing. This shouldn't depend on the wealth of a country, but focus on the vulnerability of populations. Respect for sovereignty and local reality. Tomorrow's architecture must be inclusive. It must include our voices. We cannot be simple observers and beneficiaries. We need to be strategic partners that carry weight in terms of international health security. Finally, convergence between global reform and national dynamics. We need to strengthen our local health systems. In Gabon, this is already happening through historical reforms undertaken. The recent enactment of the health law, digital health initiatives, and also the strengthening of community-based healthcare. And so we fully support the efforts made by WHO and member states to establish a pandemic treaty and a revised RSI that is fair, that is binding, and promotes solidarity. We would like to see a future architecture for health that protects every single citizen, whether he is in Africa or elsewhere. Thank you.
Chers collègues, je ne vois plus de demandes de parole.
Thank you very much, dear colleagues. I see no further requests for the floor from the member states of the Africa region. I therefore invite the representatives of member states from other regions, UN agencies, and other intergovernmental organizations who wish to take the floor to now raise their nameplates.
Merci, je ne vois.
Thank you. I see no further requests for the floor. I will therefore now give the floor to Dr. Razia to respond to the comments and the questions raised by the distinguished delegates.
Thank you, Chair. My sincere and profound gratitude to the member states to really comment on this agenda at this late hour. And I really commend Africa and the member states in the African region for the leadership, engagement, and guidance as we unfold the global health architecture reform. As has been said, absolutely, Africa needs to lead the process and be at the center of decision-making on global health architecture. The continent is already leading at regional level and continue to do so at the global level. We will continue to be guided and informed by your Vice Council, and together with partners, we aim to successfully conclude this time-bound process at the WHA 80 with all the principles that have been elucidated: equity, sovereignty, subsidiarity, and to create an architecture that is fit and delivers for one and all, and does not discriminate based on geography or on how much money you have in the bank. It is for everyone, for all, everyone, everywhere. Thank you all. Thank you very much.
Merci.
Thank you very much. The Secretariat has taken note of our Member States' recommendations and will convey them to the Member State-led task force for consideration towards the 80th World Health Assembly in 2027. It will also continue to support African region member states' coordinated and meaningful engagement in the joint process, ensuring that the region's priorities are effectively reflected in shaping the future global health architecture. I see no objections. It is so decided.
Distinguished delegates,
Distinguished delegates, this concludes our deliberations for today. Before we close today's proceedings, I would like to give the floor to the Secretariat for any announcements or practical information.
Merci beaucoup, Monsieur le Président.
Thank you very much, Chair. I'd like to draw your attention to side event 1, which is the data-driven decisions, harnessing AI to strengthen primary health care, which will take place tomorrow at 7:30 in the morning in conference room 2. The plenary begins at 9 with agenda item 8, Africa Health Workforce Agenda 2026-2035. At 5 p.m., a special session on EVD, after which we will conclude tomorrow's proceedings. Side event 2 on eliminating disease in Africa will take place at 6:30 p.m. tomorrow as well. Thank you very much, Chair. Thank you, Secretariat. I thank you all for your active participation and constructive contributions throughout the day. I wish you a pleasant evening and look forward to seeing you again tomorrow. The meeting is adjourned.
merci beaucoup. Merci. Merci beaucoup.
Merci. Très bien fait.
OK. Ouais.